Great. It's like magic. We're going to see all kinds of faces in just a moment. Right. Welcome, everyone. Thank you so much for joining us bright and early this morning. My name is Jamie Strauss-Clark. I am facilitating this Crisis Response Improvement Strategy Committee. So you'll be seeing my face quite a lot over the next couple of years. Just letting folks enter the room. I'm going to start with a very brief technology overview. I know many of you are more familiar than you ever wanted to be with Zoom and how it works. But I do want to go through it and just make sure anyone who's newer to Zoom knows how to use the tools, and also that we're all on the same page about when to have video cameras on or off, mute button on and off, and so on. So Liz, would you mind moving up a slide for me, please? All right, so we have two separate slides. They look similar. This is for our CRIS committee members. I have a separate slide I'm going to walk through for our public guests today. So Liz, I have some animations in here. Let's start with the mute button. If you could click, there you go. So your mute button is at the bottom lower left-hand corner of your screen, noted by the red arrow. I'm going to ask everyone to keep your mics muted unless called upon to speak. That will, sure you've all been in these meetings where you've heard dogs barking in the background or someone picking up a phone call. That'll just help minimize distractions, and also if someone's speaking, not have any background noise that's impacting their ability to speak. Liz, can you click again? All right, video. So CRIS committee members, if you could please, if you have the internet bandwidth, if you could please have your video cameras on. We have over 200 people signed up to participate or to be in today's meeting, and that will allow me and the other facilitators and staff to be able to tell the difference between CRIS committee members and everyone else. So if you could please keep your videos cameras on to the extent possible, that would be very appreciated. And that button is where it is noted by the red arrow there. Liz, can you click again? All right, in order to avoid talking over each other, we're going to use the raise your hand function. So what it does is it allows me to see the order in which you raise your hand wanting to speak, and I can call on you in that order. Liz, if you could click that reactions, if you could click again, you'll see when you click on the reactions button, then you get this window, and just click on raise your hand, and I will know that you want to make a comment. You can lower your own hand using that same button, or I can lower it for you. And finally, if all else fails, please feel free to just wave your hands on your screen, and one way or another, one of us will catch you. So Liz, if you could click again. All right, chat function. As I mentioned earlier, we have enabled the chat function for our CRIS committee members. The reason we're doing this is I know that there are some people who feel more comfortable sharing their thoughts or questions via written form rather than speaking out, especially in a digital setting. So we are enabling that chat function. I will do my best to track that while also tracking the discussion. That said, I know we've all heard the signs that you can't multitask too effectively. So the other staff are going to help me if I miss something you've put in the chat. But we'll try to track both and keep both in part of in the discussion, and the chat will also be part of the final record. So Liz, click again, please. Zoom has an exciting tool available now, closed caption. I know it's not a perfect tool, but for those of you who need some extra assistance to hear what's happening on the screen, you can click on closed caption, and Zoom's automatically transcribing what it's hearing. Again, it's not a perfect tool, but it is one that we can take advantage of now. I think actually on your screen, it should say CC live transcript rather than closed caption. That's what I'm seeing on my screen right now. Click again, Liz, please. Finally, if you would like to see as many committee members as possible when there's not a screen share, you can click on that speaker view button in the top right corner and click a gallery view. That's what I like to do. I can see more committee members that way. All right, moving on to the next slide, please. For our public guests, first of all, thank you for joining us this morning. We appreciate your presence and engagement in this topic. We have some slightly different approaches for our public observers. So Liz, if you could click. Same rule, please keep your mics muted while you're participating or while you're observing this meeting. Click again, Liz. But please also, if you could, keep your video cameras off. It is not that we don't want to see your wonderful faces, but because we have now over 150 people in this meeting today and 37 committee members, it does allow me as the facilitator to just make a distinction between who's in the CRIS committee participating in the deliberations and who's here as a guest. So if you could keep your video cameras off. When we get to the public comment period, when your name is called, then you can click your mute button to unmute and click your video camera to show your face. That will be when we'll have you come on screen. We also have some opportunity today to do some interactive discussion with our public guests, and that will be a great opportunity to turn your video camera on as well. Liz, can you click again, please? Same thing, closed captioning is available for our guests today, so please do click on that if you need some additional assistance hearing what's happening. And finally, click again. Speaker views, so same thing, if you'd like to see as many committee members as possible when we're not in a screen share mode, please go ahead and click on that upper right-hand button, and you will be able to click gallery view and see all of the committee members. Okay, that's it for the Zoom background. So let's do some welcome and introductions. And we're actually going to start with a land acknowledgement. And I believe Teresa Fontinos is going to offer our land acknowledgement today. So Teresa, if you wouldn't mind clicking your video camera on and unmuting and sharing your land acknowledgement, and then we'll dive into.
Great. Good morning, everyone. Before we start our meeting today, I acknowledge that as the acting Medicaid director, that I'm speaking to you from Seattle. This area is the land of the Duwamish, Coast Salish, Stillaguamish, Muckleshoot, and Suquamish. These tribes were made promises in the 1855 Treaty of Point Elliott that have never been kept. I recognize that I'm a guest on this land. I honor and thank the tribal ancestors and leaders who have been stewards of these lands and waters since time immemorial. And I commit to caring for the land and waters, the plants and animals while I am here.
Thank you, Teresa. Appreciate it. And we just got a note. Liz, can we remove the share screen so we can just temporarily so we can see our presenters? Thank you. I appreciate it. We'll go back to the share screen shortly. Thank you, Teresa. And actually, if you wouldn't mind, I understand that you, Kristen Peterson, Amber Leaders, Senator Dingra, and Representative Orwell would also like to offer a welcome to our committee members. So if you'd like to start, that would be great.
Yes, again, good morning and welcome, everyone. First, I want to thank you for your participation in this work. As a primary care provider and someone who has family members who have experienced both suicide and have serious mental illness, this work is not just important in my role as a provider, but as a person. Again, from the Healthcare Authority, your time and effort and knowledge will be appreciated as we work to serve those who struggle from factors beyond their control. So again, thank you very much. Appreciate all the work you'll be doing.
Thank you, Teresa. And is Kristen Peterson with us this morning?
Yes, good morning. My name is Kristen Peterson. I'm Deputy Secretary for Policy and Planning at the Department of Health. I wanted to welcome you and thank you for your participation in this important work. I also wanted to thank Senator Dingra and Representative Orwell for their leadership on this legislation that's brought us here today. A comprehensive behavioral health system in Washington state has been lacking, and this is really an opportunity for us to address that. I also wanted to stress that the Department of Health is invested in this work, and we will be alongside you throughout this process. So thanks again for being here and for your work, important work in the years ahead.
Thank you, Kristen. And then Amber Leaders, please.
Yeah, hi, good morning, everyone. Amber Leaders, Senior Policy Advisor to Governor Inslee. I'm really excited to get started today. This has been a long time coming. There's been a lot of work, and many of you have been involved through the legislative process and through the work that's happening already. As Kristen and Teresa both noted, this is a really important step for our state in improving our overall behavioral health system, particularly for those individuals who face times of crisis, and for their families and friends that support them. Governor Inslee has been incredibly supportive of reforming our behavioral health system since he took office, and he's incredibly supportive of this work. And I'm just passing along his thanks for your continued efforts towards this goal.
Thank you, Amber. Senator Dingra.
Good morning. To say I'm excited to be here is an understatement. I cannot tell all of you how much it means to me that you will be taking time out of your lives to do this work. You know, all of you are here as members of this committee, and everyone who is watching or logged in, you guys are here because you care. You have been working hard to improve the lives of people for years. And so when we come to this work, I really want to acknowledge that we're all here because even though we've been in this field for a long time, we recognize that there's so much more we can do, and there's so much we can do better. And so change is hard, but I do know that together we can come up with a system that will help people when they need it. The hope really is that with everyone's experience on this call, everyone's experience on anyone who's listening who wants to participate, that we can move forward together in building the system that we can all be proud of. And there are things that we do as a state that are really great, and there are things that we don't do well. And I know that the people who do this work have the ideas on how we can improve it. So I love that that is the shared goal of everyone in this group. And I also understand and acknowledge that change is hard, but I am really, really looking forward to the end product here, which are the recommendations that are going to come in and the changes we're going to make over the next few months and few years. So thank you all so much for being here.
Thank you, Senator Dingra. And Representative Orwell.
Good morning. I am so honored and excited to be here. I want to say welcome. You know, we have such a unique opportunity in front of us. You know, we live in a time when you say, how are you? And no one says fine. We're feeling overwhelmed and stressed. And for so many of us, we've been touched by mental health in our own journey, or our family, friends, neighbors. And this is our opportunity to build something better, something that's trauma-informed and caring and supportive, and really the kind of care that we all would want in crisis, or our family member. So thank you for sharing your time and talents. This is an amazing group of people, and all the voices on this committee who are here today listening in the community are so important to creating this system that really can support people. And of course, we're going to have the best in the country, and excited that we all will be part of that. Thank you.
Thank you. And I also wanted to take an opportunity to have each committee member introduce themselves very briefly. I'll just ask you today to share your name, your organization, or if there's a relevant stakeholder group that you're representing, if you could share that. And if you'd like, you may also share your pronouns that you prefer. We're going to do this relatively quickly, but we are going to also shortly do a breakout ice melter where you get to talk a little bit with each other for a few minutes. And of course, over time, we're going to get to know each other better. But in the interest of having lots that we want to discuss with each other today, we'll keep the introductions pretty short. I'm going to call on you in the order I see you on the screen. Please do, when I get to the end, if I have missed anyone, please forgive me. I am getting to know all of you as well, but please let me know by raising your hand if I have missed a committee member. We'll start with Michelle McDaniel.
Hi, good morning, everyone. Michelle McDaniel, she, her. I am the CEO of Crisis Connections, clocking in at about month 4 in that role. And Crisis Connections will be one of the 3 contact centers for 988.
All right, and Representative Dent.
Hi, good morning. My name is Representative Tom Dent. I represent the 13th Legislative District in Central Washington. It's good to be here.
Good to have you here. Heather Sanchez.
I'm Heather Sanchez. I am a social worker here at the American Lake VA, representing kind of the Veterans Administration.
And Michelle Roberts.
Good morning, everybody. I am Michelle Roberts. I'm the Acting Assistant Secretary for our Prevention and Community Health Division at the Department of Health, which includes our suicide prevention program and where the crisis and suicide prevention hotline sits. So I'm the official representative from the department to the committee and really honored to be here.
And then Adam Wasserman.
Good morning, everybody. My name is Adam Wasserman. I'm the Washington State 911 Coordinator. Glad to be here.
Good to have you. John Moran. Oh, John, you're on mute. Let me see if I can help you do that. Oh, John, you're still on mute. Let's see if we can unmute you here. Looks like it might be on your phone. If you could unmute on your phone. All right, I apologize, John. I'm going to introduce you for the group. This is John. Oh, there we go. You got it. Good.
You can hear me now?
I can hear you now, yeah.
Great. What a way to enter the group. My apologies.
Oh, you are not the only one this has happened to. Don't you worry.
My name is John Moran, but I go by Bunk, he and him. I work for CMAR Community Health Centers. And in addition to all the things that CMAR does across Washington State, we operate several crisis services down in Clark County.
Thank you, Bunk.
I'm directly involved with. Yep.
Levi Van Dyke.
Good morning, everyone. I'm Levi Van Dyke, he, him pronouns, and I'm the Deputy Director of Behavioral Health at Volunteers of America, Western Washington, which is a current Lifeline member center, one of the hub centers.
And then Ron Harding.
Good morning. My name is Ron Harding, he, him, the Chief of Police for the City of Paulsville. I was previously with the Redmond Police Department, and I represent law enforcement.
Thank you, Ron. Catherine Siebel.
Good morning, everyone. I'm Catherine Seibel. I use she, her pronouns, and I'm the Director of Public Policy and Advocacy at the National Alliance on Mental Illness Washington. NAMI Washington is the Washington chapter, the largest grassroots organization dedicated to improving the lives of people impacted by mental illness. So we do this through advocacy, education, and support programs. Thank you.
Catherine, my apologies for mispronouncing your last name.
It's quite all right.
Jessica Shook.
I'm Jessica Shook. I am the president of the Washington Association for Designated Crisis Responders and the crisis team manager for Olympic Health and Recovery Services, providing crisis services for Thurston and Mason counties.
And then Victor Liu.
Good morning, everyone. My name is Victor Liu. For this work context, I use he, him pronouns. I'm the president and CEO from Seattle Counseling Service, SCS. So SCS is the oldest organization in the country that provides mental health and behavioral health services specifically for the LGBTQ community. Very glad to be here. Quick disclaimer, I need a clone coming soon. I need to excuse myself at this meeting at 10:30, but I'll try to rejoin as quickly as I can. Thank you.
Thanks for letting us know, Victor. Jan Tokumoto.
Good morning. I'm Jan Tokumoto, and I'm the Chief Operating Officer at Frontier Behavioral Health in Spokane, Washington. We are also a 988 hub.
Thank you, Jan. Darcy Jaffe.
Good morning. Darcy Jaffe from the Washington State Hospital Association, and I'm the Senior Vice President of our Clinical Operations.
Michael Reading.
Good morning. I'm Michael Redding. I'm the Chief of Crisis Systems and Services for the King County Behavioral Health and Recovery Division. I also function as the administrator for the King County ASO.
Thank you, Michael. Michael Redding. I will say it correctly
Redding.
next time. I think this one is Carrie Waterland. Carrie, is that you? 509-423-6705?
No, I'm just on the
Oh,
screen.
I'm sorry. You're down in the lower corner. I apologize. Carrie, why don't you go ahead?
Okay, I was wondering if we wanted to do the 509, but I feel like we're going to toss it to the 509 after me. So, hi, my name is Carrie Waterland. I use she, her pronouns. I am the Division Director of the Division of Behavioral Health and Recovery at the Healthcare Authority, and I am occupying the Healthcare Authority seat on this committee. Really, really honored to be here. Thank you.
Thanks, Carrie. And I'm not sure if 509 is one of our committee members, but if 509-423-6705 is a committee member, if you wouldn't mind introducing yourself. Okay, it might not be.
Jamie, this is Representative Dent. That could be Senator Warnick.
Oh,
She was
okay.
going to be, excuse me. She had planned on being on the phone for the first part of the meeting because she has poor internet connections where she's at, and she might have poor phone service too.
Oh, okay. Thank you. Thank you, Representative Dent. Senator Warnick, is that you on the phone? Okay, we'll check back in and see. I realized Senator Dingra gave a welcome, but I didn't give her an opportunity to say more about the district she represents. So Senator Dingra, would you like to?
Thank you. Yes, I represent the 45th Legislative District, which is the King County parts of the city of Woodinville, parts of the city of Redmond, Kirkland, Sammamish, and Duval. And in the Senate, I chair the Behavioral Health Subcommittee. I'm Vice Chair of Law and Justice, and I sit on Ways and Means. Thank you.
And same for Representative Orwell.
Thank you. Good morning. Tina Orwell. I have the honor of representing the 33rd Legislative District in South King County. You've been in the airport, you've been in my district, beautiful community. I also serve as Speaker Pro Tem. I work on public safety, civil rights and judiciary, finance, and rules. And my background, I'm a social worker and mental health professional. Thank you.
All right, and then Bipasha Mukherjee.
I am, Bipasha. I am here because of my lived experience with mental health. I've also been a very long time volunteer on the crisis line for over 2 decades, and also work on raising awareness within the South Asian community about mental health and access to services and destigmatizing the whole journey.
Thank you, Bipasha. And then Dylan Nishimoto.
Sorry, it took me a moment to unmute. Hi, my name is Dylan Nishimoto. I work with Asian Counseling Referral Service. I use he, him pronouns, and I'm the clinical manager of the Children, Youth, and Families Department.
Thank you, Dylan. Joan Miller.
Good morning, I'm Joan Miller. I'm the Senior Policy Analyst with the Washington Council for Behavioral Health. We are the statewide association of community behavioral health agencies who provide crisis services all across our state. Happy to be here. Thank you.
And then Kashi Arora.
Good morning. I'm Kashi Arora. I work as the Mental and Behavioral Health Program Manager on the Community Health Team at Seattle Children's. I previously worked on the inpatient psych unit and in the emergency department there. I use she, her pronouns, and I'm representing the Child and Youth Behavioral Health Work Group. I'm glad to be here.
Thank you. Jennifer Stuber.
Good morning, everyone. I use she, her pronouns, and I'm a professor at the University of Washington, a suicide prevention advocate, and the co-founder of Forefront Suicide Prevention based at the U. Thanks.
Thanks, Jen. Justin Johnson.
Good morning, everyone. I'm the Justin Johnson, Assistant Director with Spokane County's Community Services, Housing and Community Development Department, and I'll be representing the BHASOs and specifically Eastern Washington, frontier rural communities, and agricultural communities. Thank you.
Thank you. Michael Robertson.
Hi, Michael Robertson, pronouns he, him. I'm a certified peer counselor and CIT coordinator, peer services specialist. I currently a member of the National Association of Drug Court Professionals. I work as a peer navigator for King County Drug Diversion Court, the pre-adjudication court out of that model. I live in the 43rd Legislative District, and I know if you've been involved in mental health and you're a clinician, then you've heard that coming across your radar and some of the behaviors and activities that are happening within the last week. I'm just glad to be here, and I have a lived experience with the war on drugs. 1996, my first prison term, and then made it out of there when policies began to change and give people a chance. And so I'm here to offer my perspective, and I'm glad to be here. Thank you.
We're glad you're here, Michael. Linda Grant.
I'm Linda Grant. I'm the Executive Director or the CEO of Evergreen Recovery Centers in North Sound, with offices with PCAP programs in King and Pierce County. And I'm here representing the Association of Alcoholism and Addictions Programs that I'm the president of. And that is the statewide addiction treatment provider association. And my pronouns are she, her.
Thanks, Linda. Summer Hammonds.
Good morning, everybody. My name is Summer Hammonds. I'm a Tulalip tribal member. I'm a legislative policy analyst for Health and Human Services, and I work for the Tulalip Board of Directors, and I represent the western side for Native Americans as well. So thank you.
Thank you, Summer. And Daria Farivar.
Good morning, folks. Daria Farivar with Disability Rights Washington, the state's protection advocacy agency. Thanks for having me.
Thanks for being here. That is everyone I'm seeing on my screen. If I have, oh, let me check with Senator Warnick. Senator Warnick, are you with us? Okay. Have I missed any committee members? If you could please raise your hand if I have missed you, or throw it in the chat. Oh, Caitlin, my apologies. Caitlin Safford.
Yes, hello, good morning. My name is Caitlin Safford. I'm the Chief of Staff for AmeriGroup Washington, which is one of the 5 Medicaid managed care organizations in our state, and I'm here representing the managed care organizations. I apologize for not being on video. I have a sick toddler at home, so I'm trying to manage.
Oh, I'm so sorry. I hope your toddler gets better soon. Any other committee members who I've missed? Okay.
Jamie, just for your knowledge, Senator Warnick is hearing you. She just can't communicate, but she's been texting me, so she knows.
Oh, wonderful.
Okay.
She might need to unmute her phone, which is
Well, I think it might be a different issue, but
Yeah.
anyway, she's listening.
Okay, welcome, Senator Warnick. It's nice to have you here. Thank you for joining us despite the internet issues.
And Senator Warnick is my seatmate and represents the 13th legislative district. So
thank you, Representative Dent, for a big proxy for her voice. We appreciate that. I would also just like to take a moment to have staff introduce themselves so you know who is working to support you in this work. So I'm going to just ask staff, I'm going to call your names and ask you to introduce yourselves as well. And let's start with Betsy Jones.
Hi, everyone. This is Betsy Jones. I'm with Health Management Associates. You'll hear a little bit more from me in a bit, but we're leading the work to facilitate all of these committees and the subcommittees and make sure that the wheels stay on the bus. So nice to be here.
And Nicola, would you introduce yourself, please? Nicola, you're muted. Okay, she might be working on a technical issue right now, but Nicola is our project manager, and she is the person who's keeping all of this rolling and seamless. So you will get to talk with her many times, I think, over the next 2+ years. Liz, would you introduce yourself, please?
Hi there. I'm Liz Argent. I'm a senior consultant with Health Management Associates and part of the team that is supporting the great work that you all are embarking on. It's great to be with you, and I look forward to getting to know all of you through this process.
Okay. And everyone, I am catching our staff off guard. I had originally not intended to introduce them, but I'm realizing that you need to meet them. So that might be why they're a little bit surprised that I'm asking them to speak up. Let me just ask also Jim Volendroff, if you are available, if you would mind turning on your camera and saying hello to folks.
Yeah, good morning. Thank you, Jamie. Hi, Jim Volendroff. I'm the Behavioral Health Senior Advisor for Policy and Advocacy for the Department of Psychiatry, University of Washington. Also here with the Behavioral Health Institute, supporting Jamie and Betsy in this work. And I just want to echo what Senator Dingra said. I couldn't be more excited to be here today. This is an extraordinary day, and I'm just so grateful to be a part of this and looking forward to see where we end up here in a couple of years. So thank you.
Thank you, Jim. I have a few more staff that you're going to be talking with today, so I want to make sure we introduce them. Mark Snowden, would you mind turning on your camera and saying hello?
Sure. I'm Mark Snowden, a professor in the Department of Psychiatry at the University of Washington, and a practicing geriatric psychiatrist, and work with the Behavioral Health Institute, and I'm pleased to be here.
Thanks, Mark. And then Suzanne Rabideau.
Good morning. I'm Suzanne Rabideau. I'm with Health Management Associates. I'm working with the team. I bring experience of starting up crisis centers, call centers, mobile teams, psychiatric facilities. I've worked with states, governments, communities, peer representatives to design and implement, and I could not be more happy to be with all of you to work on and see where this will be in 2 years from now. So thank you.
Thank you, Suzanne. And I'm not sure if Michael Anderson-Nathy is on yet, but if you are, oh, there we go. Hi, Michael.
Hi, everyone. My name is Michael Anderson-Nathy. I use he, him, his pronouns. I'm an independent consultant working with HMA on this project. I do a lot of work in social justice and equity work, community engagement, community health, and I bring lived experience as a person of color and member of the LGBTQ community. And I'm very happy to be on this project and to meet all of you. So, hi.
Great. Okay, so I think that covers the stuff you're going to be engaging with today. You should know there is a whole wonderful team of people behind this helping to move this ball forward. So you'll be interacting with a lot of folks over the next 2+ years and have an opportunity to get to know them. I do want to take a moment to walk you through what's going to be happening today. So Liz, if you wouldn't mind doing a screen share again, let's look at the meeting objectives and the agenda. Thank you. So next slide. All right, so our objectives today, first and foremost, are to start this process of building and sustaining collaborative relationships with each other. The success of this committee really rests on our ability to work together successfully and listen to each other's perspectives. So that's a big part of what we're wanting to accomplish today and at every meeting. We also want to make sure everyone has a baseline understanding of the behavioral health system redesign process. That is a bit of a tongue twister. I know many of you already have this, and when we've done our introductory meetings with each of you, people are very, very up to speed on this process. So we're gonna do this at a fairly quick pace, but make sure that everyone's starting in the same place with this process. We are going to affirm that CRIS committee charter that we sent out to you last week. So we'll walk through that and get any of your feedback, make any revisions necessary, and then hopefully affirm that today. That's going to be our guiding document moving forward for how we work together. We're going to spend a little time securing a baseline understanding amongst all CRIS committee members of first the history and context of the crisis response system and the effort to get this House Bill 1477 passed, but longer time on outcomes for the Vibrant 988 state planning grant effort, including how we're taking this, Washington's doing something unique here, leveraging this opportunity to work on redesign of the crisis response system. We'll have some time to engage with each other, so you won't just be listening to presentations on what success will look like at the end of this process, confirm action items and next steps, and then we will hear public comment. And public comment is going to be an element of every single one of our CRIS committee meetings. So I'm going to walk you through the agenda, and then I'm going to take a moment to talk about how public comment is going to work. Liz, if you could advance the slide. All right, so we're almost through the welcome and introductions. We're going to have a personal story from Bob Krulish, who's generously offered to share his own experience with us. Then we're going to do an ice melter for our CRIS committee members. You're going to go into breakout rooms and just engage with each other briefly. Our public guests will stay in the main room with me. We have a kind of a fun poll for you to do while we do this ice melter with our CRIS committee members. Then there's going to be a presentation to review the behavioral health system redesign, organizational structure and process. We'll affirm the CRIS committee charter, and then there will be a stretch break around 10:20. That'll be 10 minutes, give you a chance to step away, stretch your legs, do whatever you need to do. When we come back together, there'll be a presentation level setting around the history and context of 1477 and the outcomes of the Vibrant work. We'll have an interactive discussion in breakout rooms again. And again, members of the public, please, you'll be staying in the main room with me, and we'll have a similar discussion here. Then we'll do action items and next steps and have public comment. I'll take 2 minutes at around 11:38 to walk everyone through how this is going to work, and then we'll have 20 minutes of comment and adjourn at noon. That's the slide, please, Liz. These are the rules for a public comment. These actually went to everyone who signed up to make a comment. I want to call your attention. We allocate 2 minutes for each speaker, but today, because we have 29 people signed up to make comment, in order to get as many folks in as possible today, I'm going to shorten that to 90 seconds for comments. I want to let folks know that that's going to be happening. We're going to be shortening it to 90 comments. We're going to adhere to that timing pretty strictly so that we can make sure as many people as possible can comment today. But I also want to let our public guests know, if we don't get to you today, or if you're someone who prefers to provide your feedback in written form rather than spoken form, don't worry, we have ways for you to provide your feedback. I am going to put in the chat an email address. This is where you can send your comment. And I want to assure you that our CRIS committee members will see these comments. We are not weighing verbal comments any heavier than comments spoken in the meeting. So please do, if you have a comment to share, please do send it to this email. We'll make sure we send that out again multiple times throughout this day. Liz, can you advance the slide? I'm just going to show you the list of folks who are commenting in the order they're going to comment. So this is our list. This also went out to our folks who signed up to make public comment yesterday. We'll take it in the order that people signed up. I realized actually we have 28 because we skipped number 7 here. So we have 28 people. So I'll do my best to get through as many people as possible in the 20 minutes. All right, I think that is it for what we need to do now. So I'd like to turn it over to Bob Krulish to offer a personal story. Liz, if you could stop the screen share, and Bob, if you could turn on your video camera and your mic, if you could share your personal story with us.
I'd be happy to. Can you hear me all right?
Yes, you sound great.
All right, great. My name is Bob Krulish. I live in the Sammamish, Washington area. I was symptomatic with bipolar disorder symptoms when I was 16 years old, and I got diagnosed quickly at the age of 51, 35 years later. And that is really in part due to just really not recognizing the symptoms of bipolar disorder in society and in the medical community. At certain points in my life, I went to the doctor complaining about certain things like anxiety and other things like that, but I was never correctly diagnosed with bipolar disorder. It wasn't until about 32 years into my bipolar symptoms that I had a severe manic episode because I was incorrectly given an antidepressant medicine for my anxiety disorder that my general practitioner felt like I had. It made me manic, and it ended up taking away everything from my life. In that manic episode, I lost the job and lost a career job that I had. I was fired because of my behavior. Then about a year after that, I got divorced from a 25-year marriage. And then I signed away everything to my wife at the time. I signed away all my custody of my children, access to my children, all the wealth that we had developed, and ended up sleeping on the floor of an abandoned cabin out in the woods. I slept on the floor of that cabin for 2 years all alone with really no support. I went back to the courts and asked them for help about the settlement agreement that I had signed and where I'd given away all my money in my manic break. And the courts just scorned at me and laughed at me and said, you just have buyer remorse, and really just gave me no peace whatsoever about the settlement agreement. It was then later on that my ex-wife then put me in a parenting plan. I was only able to see my kids for 3 hours a month, twice a month. So I saw my kids for 6 hours a month, or 72 hours a year. And that got to be supervised for no harm that I've ever done to my children. And it's all because of my mental illness. I was just treated so unfairly in the courts. I went to the courts and I asked for the parenting plan to be lifted, and they again scorned me and laughed me out of court. And they did not really have any consideration for the fact that a person with a mental illness, now I was treated and I was doing well, I was living well, could be well enough to not be supervised with their children. And that went on for 6 years. I finally got it overturned in appellate court, but it wasn't until my son was already 18, my youngest was already 18, so it really didn't do me much good. I just wanted to really just emphasize the fact that that a person with a mental illness goes through these kind of processes and really doesn't get the kind of consideration that they ought to get because of their mental health condition or mental illness. I now work with parents that also deal with a loved one that has a mental health condition, and I find that their access to care or their access to facilities, treatment, things like that to be very difficult in the state, more so than it ought to be. And so what I really want to just emphasize to the committee is that people do well with the mental illness. That once I got properly diagnosed with bipolar disorder at the age of 51, and after many med changes and a lot of hard work, I do very, very well. And I do want the committee to realize that the response that we get in this state isn't always so positive. And I look forward to the work that this committee can do to make it more positive for those of us with a mental health crisis. Thank you so very much for letting me share my testimony and my experience with this today.
And thank you, Bob. We really appreciate your generosity in sharing your personal story with us, and it's meaningful for us to hear that. I'd like to take a moment now to give our CRIS committee members an opportunity to just start to talk with each other. We're going to do a little ice melter and put you into breakout rooms with just a few of you. So there'll be 4 or 5 of you in each breakout room. And the prompt question today, which you may use or you may talk about whatever you want in these breakouts, is what are you grateful for today and why? I'm going to put that in the chat as well. In just a moment, we're going to move our CRIS committee members into breakouts, and our guests from the public, you'll be staying in the main room here. We have a poll for you to keep you busy while our CRIS committee members are in the breakout rooms, and that'll be about 5 minutes. We'll bring everybody back. So what are you grateful for today and why? And I'm going to send that out to everyone. And then Rachel, or I'm not sure who's moving folks into the breakout room, but if you could send our people to the breakout room now, that would be great. Brittany, are you sending folks to the breakout room?
Brittany, we're having a little bit of a technical issue, so thank you for being patient, everyone. Okay, I thought that they were pre-assigned, so just a second here. Okay. Okay, here we go.
Okay. All right. And in the meantime, for our guests here, Suzanne Rabideau has put together some poll questions for you. Liz, are we able to run that?
Sure, just a second. Get that going. And Jamie, how long are we? I'm going to need a little guidance from you.
Sure, yes. People will be in the breakouts for 5 minutes, and if you could send them a notification when they have 1 minute left, that would be great.
There you go.
All right, so this is a trivia poll that Suzanne Rabideau put together. Please feel free to participate.
Oh, apparently, okay, just a second. We're having a problem with the breakout rooms. Just a second. Go ahead and we'll do the poll.
Okay.
Jamie, we're having an issue because everybody is in one breakout room.
Oh,
I think.
oh yeah, Liz, does look like everyone moved into one breakout room.
I don't know what happened. There was no pre-assignment. So I'm gonna have to, we're gonna have to just randomly assign people, if that makes sense.
I believe we're all back in this main room. My breakout group just came back.
All right.
Betsy, was it a giant room with everyone or was it broken out?
Okay.
It was.
You know what we're going to do? What we're going to do today is we will make these ice melters something that we do moving forward.
I also have a suggestion too, Jamie. If we share the list of rooms that people should go into for the next breakout room, we can share that on the screen and people can send themselves to the room.
Okay, when we get to our interactive discussion later on today. Okay, great. So for the time being, what we're going to do is we're just going to move on with our agenda. I apologize that the ice melter breakouts did not work out. Just a little background, our wonderful HMA staff person who's running this meeting, her laptop decided to freeze up. So and she can't reboot it without closing our whole meeting. So that is why we're a little bit pitch hitting, but everyone, I know you've been through a lot of these the last 2 years. We will iron out the kinks in these remote meetings. So I will make sure that our next opportunity to get together in these ice melter sessions will happen in the future. I also wanted to, I see that Puck Frenta, who's another one of our wonderful committee members, is with us, and I wanted to give Puck an opportunity to introduce themselves. So, Puck, would you mind unmuting and?
It sure wasn't my goal in messaging you, but hi, I apologize for being late. What am I just? Context. I'm from Yakima. I am a non-binary, was not ready to do this right now.
I'm sorry.
No, I have ADHD, but I wasn't diagnosed until just a couple of years ago. And so I spent most of my life being like, what's wrong with me? Because I didn't have the executive functioning skills to do life. So I speak for myself, and I also have been with a lot of people going through a lot of challenges, and I don't speak for them, but I am familiar with their experiences as a non-binary person, as a queer person, as a fat person, as a neurodivergent person. So that's why I'm here. And I'm also hoping, as someone who's chosen to be a member of the committee, to also have more conversations with my communities and bring that knowledge to us as well. And then, yeah, what I was saying was that someone mentioned that we didn't take a moment to thank the person who had spoken before we broke out, and just to recognize and appreciate him sharing his story. So that was the thing that I messaged you about, Jamie.
Yes, and I'm sorry for catching you off guard, Puck, there with asking you to introduce yourself. And I do actually, Representative Orwell, would you like to just say a word also to acknowledge Bob's generosity in sharing his story with us today?
Absolutely. Bob, thank you for sharing your story. It takes incredible courage. It's so personal, and it was so heartfelt what you shared with us. And I want to say I'm sorry the system failed you, and thank you for coming and sharing and helping us build a better system that would support everyone that reaches out. And we're just so glad you're here. So thank you.
Thank you for that, Representative Orwell, and Puck, thank you for raising that. And also Laura, thank you for raising that. I apologize for not adequately thanking Bob for his contribution today and bravery in sharing his story. Okay, let's keep going. We're going to move into our presentation of the behavioral health system redesign process. Betsy is going to share with us, but let's actually turn it over to Mark Snowden, who's just going to say a few words about HMA and their role on this work. Mark?
Great, thank you, Jamie. It's a pleasure to have Health Management Associates working on this project to facilitate these meetings. It is a huge project that is very important, and so here at the Behavioral Health Institute at Harborview, we recognize the need to bring in a consultant like HMA. Even more important than that, Betsy Jones, many of us know from her extensive work in the state and local area in terms of government, both physical health and behavioral healthcare interventions. And so I couldn't be happier than having her as the executive project manager for this project. So now I will turn it over to Betsy.
Thank you, Mark, for the kind words. Hello again, everyone. My brief introduction was intentional because I knew this was coming. Want to say that I'm so pleased to see all of your faces. Jamie and I and Jim have had conversations with all of you, and we're really just so appreciative that you are here. Also want to acknowledge members of the public and say that Health Management Associates is going to work hard to make sure that we're facilitating and supporting with subject matter expertise and process support the work that you all are doing to achieve the vision for a system that works for everyone who needs support. We have a couple of brief slides to share. Those CRIS committee members CRIS committee members will be familiar with this information, but for members of the public, it might be informative. So could we share the slides, Nicola?
I have the slide deck, Betsy, just a second.
Okay.
And also, Jamie, I, because of this issue that we had with breakout sessions, and I want to be prepared for the second breakouts, Jamie, are you able to share the slides on your computer so that I can make sure that's ready?
Yes, let me do that.
Thank you. And also just a request, if you are a member of the public and not a member of the committee, can you please turn your video camera off? Thank you.
Okay, bear with me one moment.
And thanks again for your patience with all this.
Best laid plans as I talk about HMA.
There's always technical issues. We know this.
Okay.
There you go. Looks great. Not in presenter mode yet, though.
Okay, bear with me. Can someone remind me how to do it on Zoom?
Just hit slideshow.
No, I'm in slideshow. It's the Zoom view that I need to, let me try something different here. Let's try this. That
It's still showing the side, the left-hand side. So you're not,
There
oh,
we
there
go,
it is.
Jamie.
There it is.
Okay, great. Thank you.
Great. Okay, so I'm going to talk just for a moment or two about our redesign process and the organizational structure that we put in place. So advance the slide, please. Yes, thank you, Michelle. Everyone, thank you for extending grace. That's really so important. Yeah, we can't do it without one another. So, and I think this committee has already demonstrated a lot of grace in moving forward. So first slide. There we go. Okay. As Mark mentioned, HMA is contracted with the Behavioral Health Institute at Harborview to provide facilitation and backbone support to the CRIS committee, the steering committee, and the subcommittees that have been named in the report, and probably additional subcommittees to fulfill the legislative deliverables. So I'll just talk for a minute about the work ahead. In January of this coming year, we have a first legislative progress report due to the legislature and the governor. And that will consist of a comprehensive assessment of the current behavioral health crisis system, as well as some funding recommendations for the launch of the line, the 988 line, as well as ancillary services. You know, what else is needed once someone calls the line and needs services. So we'll be making some initial funding recommendations related to the account. And then in January of 2023, a year later, we have a second legislative progress report due, which will include recommendations related to the crisis call center hubs, another very important component of the work ahead, as well as final recommendations related to funding services from the account. So next year will be a big year. And then in January of 2024, we have a final legislative report due, which includes recommendations in more than 13 areas outlined by the legislation. So the CRIS committee will be looking at various and sundry things related to the vision for a redesigned crisis system, for what the call center lines should look like, and how we will kind of integrate all the services around both the line and then the services in the community. Next slide, please. The structure of our work is thus: the CRIS committee, you all, 37 members. It says 36 members, 36 outlined by the bill, but we have 37 members currently, 10 who are designated seats and 26 who are appointed or requested by the Healthcare Authority. The CRIS committee, you all, make recommendations to the steering committee, which consists of 5 folks: a designee from the Healthcare Authority, who is Carrie Waterland, a designee from the Department of Health, Michelle Roberts, and a member from the Office of the Governor, Amber Leaders, a Senate member and a House member, Senator Dingra and Representative Orwell. And those 5 members of the steering committee are also members of the CRIS, and they're sitting with us today. Additionally, there are subcommittees that have been designated by the legislation, and there were 5 subcommittees designated initially: a Tribal 988 committee subcommittee, a Credentialing and Training subcommittee, Technology, Cross-System Response, Confidential Information, Compliance and Coordination subcommittees. And then we've added a Lived Experience subcommittee, and there will be more information forthcoming about that. We're in process with some thinking about how to stand up that Lived Experience subcommittee alongside these others, as well as a Rural and Agricultural subcommittee. We're in process with that as well. And we expect to launch these subcommittees in October, and again, more information forthcoming. So that's the structure of our work. The subcommittees make recommendations up to the CRIS and then up to the steering committee, which makes final recommendations, as I mentioned, to the legislature and the governor. Next slide, please. This is a little bit of a busy timeline, but I just wanted to point out to you all that there's a lot of work happening currently. We began in August with project launch and planning, and we've been working furiously since then to develop this comprehensive assessment. Suzanne Rabideau, who's on our call today, who you met briefly, and Mark Podrazik, who is also an HMA staff person, are primarily working, and with a lot of support from the rest of us, on the development of the comprehensive assessment, as well as the funding recommendations that are due in January. So you'll see in the light yellow, the work that we're doing currently around gathering data to inform the comprehensive assessment. We're looking at raw data. We sent out surveys to the behavioral health community. We're doing interviews with the BHASOs and the MCOs. And we're doing 5 community focus groups, which we will be talking more with you all about. We want to get the word out. Those will be happening the last 2 weeks in October. In November, we'll be bringing back a preliminary comprehensive assessment report for your review. And then in December, there'll be a final draft comprehensive report that will go to the legislature and the governor in January. And on the line below, you'll see that we have a number of meetings scheduled, and you all should have those on your calendars now. And we will be working very diligently into the next year, and more updates to come about the work ahead. Next slide, please. So as per the legislation, the steering committee has selected 3 co-chairs from among its members to lead the CRIS committee, Amber leaders, Representative Orwell and Michelle Roberts. And in order to advance equity and transparency, the steering committee has decided to add a 4th co-chair to be appointed by CRIS committee members. So you all will select the 4th co-chair.
Betsy, may I jump in for just a moment? I'm sorry to interrupt, but Senator Dingra just wanted to say a few words about that. Would that be all right if she?
Yes, yeah, Jamie, I was going to speak to
I'm sorry.
Okay. Over to her. That's okay. But Senator Dingra, do you want to jump in now? I'm happy to cede the floor to you.
Thank you so much, Betsy. I just wanted to explain it because I do take responsibility for the way this process came about. And I'll just say this was a change that was made in the Senate on this bill. And the intent always was to ensure that we had a co-chair who was someone with lived experience. It's very, very important to me and so many of the stakeholders here that, that we center the voice of individuals who are seeking these services and individuals who need the help. And so there was a problem with the editing. I didn't get it quite right, so I apologize for that. And so that's why we need the 4th co-chair. And I have reached out to one of our peers and asked if she would be willing to be nominated. And so I'll wait for you to do the nomination process and talk about that. But that's the reason why we have the 4 instead of the 3 that's in the bill. So thank you for letting me explain the background on that.
Of course. Thank you, Senator Dingra. So the process that we will embark upon is to ask those who would like to be nominated or who would consider being a co-chair to provide us with a brief biography. And then we will be putting forward an anonymous poll to select a candidate. And based on the vote from you all, a co-chair will be selected and invited to the November steering committee meeting as a non-voting member. And we will share the results of the election process, the selection process with you all via email. So we're putting the word out now to those of you on the committee with lived experience. Would love to hear about your interest, and we will move forward accordingly to name that 4th co-chair for the next meeting. So Jamie, did I miss anything? Would you like to add anything about that?
I don't think so. I think you covered it well. Thank you.
And I believe that's the end of my slides.
All right, so I'm going to stop share.
Oh, and Jamie, I got a clarification. I think a really important clarification here. This is a seat for the co-chair will be someone from a lived experience seat, not just a member with not someone with lived experience necessarily, just from our CRIS committee seats. So thank you for pointing that out.
And for those of you who do hold those seats, if you are interested, we would be happy to talk more with you about what that commitment looks like, recognizing that your lives are busy and we need to acknowledge and honor that would be an additional commitment. And I see a note here from Senator Dingra asking if members of the committee can nominate someone, or do they need to nominate themselves? I certainly think if members of the committee want to propose someone, you should feel free to do that. However, we will check with that person to make sure that they are comfortable accepting that nomination. So please do let us know if there is someone that you'd like to nominate in particular. Before we move on, I do want to pause and ask if there are any clarifying questions about what Betsy has presented today. And please use your raise your hand function to let me know if you have a question. Or as I said before, if all else fails, feel free to wave your hands on your screen and I'll catch you there. Any clarifying questions? Let's see here. Well, then let's move into, I see Jen Stuber's hand up.
Yeah, thanks. So the list of the subcommittees, curious as to whether those are like set in stone or whether there's the possibility for additional subcommittees, related to crisis stabilization and mobile crisis teams.
Betsy, would you be able to answer?
Yeah, I'm trying to get off mute. Yeah. Jen, we will absolutely be considering additional subcommittees. We started with the ones that were legislatively mandated, and then the extra ones that were pulled forward by request, just in terms of priorities. But we are absolutely considering the addition of more subcommittees. So, very much appreciate your thoughts about that, Jen.
Are there other clarifying questions from our CRIS committee? Okay. And for members of our public, I didn't clarify about asking questions. Unfortunately, we have to keep plowing through our agenda today, but if you have any clarifying questions about our process, please do send me a chat. Alternatively, please do send an email to the email address that I posted earlier, and I'll post it again momentarily. We do want to be responsive to you as well. So if there are questions that you still have lingering, please use those mechanisms to reach out. Look and see if you have any other committee questions and check the chat here. Okay, great. Let's move on then to talking about our charter. So hopefully each of you received, I'm just going to enlarge the screen here before I share it. Hopefully each of you committee members received a copy of this charter in your meeting materials. All right, so is everyone, if you could give me a thumbs up to let me know you're seeing the charter on your screen. Great, thank you. All right, so this is going to be our kind of guiding document. So hopefully you've had a chance to read this. It articulates our purpose and charge, and also our rules of engagement, rules and responsibilities. I do want to call out one small change that we caught yesterday. It's at the bottom of page 1. It's clarifying that the steering committee is making recommendations to the legislature, not actually redesigning the integrated behavioral health crisis response system. So that's what this addition is here. And of course, the CRIS committee is advising the steering committee on these recommendations. So I'm just going to very briefly walk you through the highlights of this charter. Michael Anderson-Nathy is going to offer a few other remarks regarding, in particular, the language in here about equity and inclusion. And then I will check in with all of you to see if anyone has any suggested changes or updates to this before we affirm it. So the first page is about the behavioral health system redesign. It's very much like what Betsy just shared with you. We talk about the charge of the CRIS committee. As a reminder, our role is to advise the steering committee who's going to be deliberating and making those final recommendations to the legislature. And I apologize if I'm causing motion sickness with my scrolling here. I'm going to pause here because we added language around the importance of centering our work around equity. And I'm going to ask Michael Anderson-Nathy to share a few words, if you don't mind, Michael.
Yeah, of course. Hello, everyone. While you can see what is in the charter here, and I'm sure you all have had a chance to read this, and this is a really good start for us as a committee to figure out ways in which we will kind of take deliberate actions to center equity. But in our conversations, and just recognizing that centering equity is still an emerging and new practice for some and for committees in doing this work. And so we understand that, you know, everybody is at different places with their understanding of what this work looks like, what it means. And so we are wanting to spend more time as a group in future meetings to really kind of flesh this out and really develop a shared foundation for what centering equity means in this particular project and for the CRIS committee. And so we're going to have future conversations with all of the community members where we're hoping that you'll bring your skills, experience, and passion to that conversation. Our goals are going to be to create a shared vision or understanding of what do we mean on the CRIS when we say we're going to center equity here. You know, develop some shared language and foundation around those core concepts, and then what that looks like in action to guide this work. So look forward to future conversations around this. And you know, we need to recognize that centering equity and putting this into practice is an emerging or an iterative process. And so we're going to kind of keep coming back to this conversation as we move forward. So.
And actually along those lines, that reminds me of something that I should have mentioned very early in this meeting when we were doing the technology review, which is for future meetings, we're going to secure an ASL interpreter for people who have hearing impairments. So you can plan on that for future meetings, particularly if you're finding some frustration with the live transcript that Zoom is producing. I'm going to keep taking us through, and thank you, Michael, for those remarks. I appreciate your involvement on this. This table talks about the specifics, as Michael said, for what we'll do to center equity. This section on page 3 is about our membership, and this comes from the legislation. I want to highlight that if you find that you need to step down from your role on this committee, there is a process for replacing you, and it's not you choosing your own replacement. So please do let me know if that comes up. Of course, we want all of you to be with us throughout, but I know that life happens and changes happen. So please alert me if you need to step down from the committee at some point. We have a process for replacing your role on the committee. Similarly, if you, again, life happens, we've mapped out our meetings through 2023, but I know that there will be conflicts for, probably everyone will face a conflict at one point or another. We are not going to be having alternates unless it's been designated specifically by the legislation. And this is largely because this is so much resting on collaboration and building knowledge as we work together. And so it would be very difficult to incorporate alternates. So the plan is if you have to miss a meeting or a substantial portion of a meeting, please let me know as soon as you can, and we'll schedule either a preview discussion or a follow-up discussion or both to make sure that you're up to speed. And if you have input on any of the deliberations, you can share that with me. And we'll have a special section of our meeting summaries that will document the feedback that we've received outside of the meeting. So moving on. Oh, and finally, if you find that you're missing a number of meetings in a row, that could make it very difficult for you to participate when you return. So I will follow up with you if I haven't heard from you, and we'll talk about whether or not you are overcommitted and not able to stay on the committee anymore. Moving on to roles and responsibilities section on page 5, this articulates what each of our responsibilities are as a participant on this committee. I want to highlight, particularly given our discussion about the 4 committee chairs, the 4th committee chair, the co-chairs will work with the project team to prepare meeting agendas and plan our CRIS committee meetings. You'll also take responsibility for helping to communicate the outcomes of steering committee deliberations with this committee. Those steering committee meetings will also be open to the public, and you're all welcome and invited to attend, but I know that that may not be realistic for all of you to attend all of those steering committee meetings as well. So our co-chairs will be communicating with you about those deliberations. And then in addition, periodically working with me to review our progress and make course corrections as needed. I'm going to keep going here because I want to have an opportunity to hear your feedback. We've got some meeting guidelines. I'm going to ask each of you, if you haven't spent any time looking at these, please do after this meeting. These are really important. We're going to use these as our guiding approach, and it's very critical that we follow these so that we can be collaborative and do our work well and productively together. And finally, as I've mentioned to many of you in our introductory meetings, we have some detail here that We had to start adding a couple of years ago around participating in remote meetings, and we see that happening for the foreseeable future. But if we do get to a point where it's safe to gather again in person, I will be touching base with you about logistically the logistical feasibility of that for you, for whatever reason, if you have to travel far or if you have other needs. So don't worry that we won't spring an in-person meeting on you. That covers the main bulk of this document. I'm going to stop talking and ask if any of our CRIS committee members have any feedback on this charter or any changes that you would like to propose. I see hand up from Amber.
Yeah, hi, Jamie, thanks. I just wanted to go back to the thing at the top where it was talking about advising the legislature. I think the bill actually provides that the progress reports from the steering committee go to both the governor and appropriate committees of the legislature. So I just would include a nod to that piece as well, that there's an advisory piece to the governor's office as well as to the legislature.
Okay, let me find the specific spot.
Thank you, Amber. I spoke to that and then we missed it in the charter, so appreciate your comment.
Amber pointed out, if you don't mind pointing out to me where.
Oh, I'm sorry, I can't see the text very well. I think just maybe when you described it, it said.
Oh, here we are. The steering committee ultimately, I found it. We have governor and legislature down here, but we missed it up here. So thank you for that.
Thank you.
Appreciate that. Good catch. All right, Linda.
Thank you. You know, you probably can't change the charter that is part of the legislation, but one of my concerns is that the crisis, you know, we're in an integrated mental health and SUD system, but there's not true or full integration yet. And the crisis response for persons with addiction and substance use disorders is still pretty much the detox centers or not mental health, and the funding and everything for mental health is under the ASOs. And I find that that creates some real barriers in truly addressing the needs of persons with substance use disorders. And so I'm wondering if we could include in the vision that we look at the crisis system also encompassing both SUD and mental health.
I think that that is something that we can add here if others agree. This section here that I'm going to highlight with my cursor does come from the legislation, but I think it would be reasonable if others agree to add a bullet that says something to the effect of ensuring that the system serves people with substance use disorder in addition to other behavioral health issues. And
Yeah, and serves in an appropriate fashion. I don't think that they're being ignored, but I've watched the data during COVID and there's tremendous numbers that are showing up in emergency rooms. And yet, if you look at the call center responses, they're primarily oriented toward, there's very little referral to alcohol drug programs. So I think there's still some disconnects that we need to look at in order to get people to the right places. And I think part of it is the system for crisis in SUD is falling apart and the detox programs are diminishing. And so there are fewer and fewer of those, and the solutions are not just all secure detoxes because most of your people in crisis don't need to be committed. So, so anyway, I would like to see a broader view of how we address crisis.
Let me ask, I'll read this language since you said you can't really see it very well. If we added a bullet at the end that says recommendations to serve individuals with substance use disorder in crisis in an appropriate and comprehensive way.
Perfect.
Thank you for that contribution, Linda.
Thank you.
Carrie.
Yeah, I think just to support and echo kind of Linda's point, when we talk in Washington State about behavioral health, that really does mean the integration of SUD and mental health. But I think that to Linda's point, maybe the CRIS committee, we really want to make sure that we're all operating under the same definitions and that we aren't leaving some of those pieces behind. Behavioral health also includes problem gambling, eating disorders. And so I think many needs can present in a crisis situation. And so I want to just make sure that again, to Linda's point, we are being really inclusive, and that when we say certain words, this group, we all know what we mean. So thank you, Linda, for bringing that up, and thank you for letting me get on a soapbox really quickly.
I appreciate that, Carrie. And I see a comment also from Senator Dingra that I want to call out, suggesting it might be worth thinking about a subcommittee that can look at integration between substance use disorder and mental health as well as physical health. So that's certainly something for consideration. I see hands from Jessica and then Michael. Jessica?
Thank you. I just wanted to also emphasize not only the importance of including SUD specifically in crisis outreach and crisis response, but also recognizing that often people in crisis are dealing with multiple factors. And for a lot of the people that we see in crisis, it's both mental health and substance use disorder and any number of other issues that are going on. And oftentimes it can be harder and more complicated to find resources that can meet the whole person and not just kind of divide out, like you need to get this treated first and then you can go get this other piece treated. So just that it's kind of all in there together.
Jessica, it sounds like as we're thinking about how we approach this, we're going to have to think very holistically about all of the pieces that intersect to create crisis for people. Thank you for that comment. Michael.
I'd like to just echo what Suzanne said, that the response is going to be dependent. The response has been dependent on the demographic needing the response or within the crisis. And so some demographics may get the correct response. Other demographic may have the same crisis and get it hijacked by what has caused this outrage, and why we're even sitting here right now is the law enforcement in certain instances has hijacked it and interpreted the crisis for themselves. And so we have to make sure that, and I agree with everybody who's spoken so far, we have to make a delineation between each of these things so that we can get a clear picture. We have to have a clear picture of SUD, mental health. Are those two things happening together? Because we know that certain drugs are bringing on certain behaviors in certain crises. Some are not crisis at all to deal with drugs and they're just mental health. Some are just a crisis that doesn't need responses. So we need to delineate each of those things. And so that it isn't hide. The whole idea of this is so that we don't have one demographic screaming about what the hell are they doing here, right? Why did we have a result? Why do we have an outcome like this? And so I just want to make sure that I agree that we need to delineate each of those things and so that they're very clear.
Was muted. Thank you, Michael, for sharing that. And that echoes actually what I heard from many of you in our introductory meetings about how important it is for these services to be appropriate to the person who's receiving them and all of their needs. So thank you for raising that and the complexities of how different demographic groups are dealt with differently, even if they're having a similar crisis. So thank you for that. Any other comments or questions on the charter? Okay, so I'm going to ask everyone, this is a formality, but it's an important one since this is going to be our guiding document with the edits that I've added here, the one proposed by Linda, the edit proposed by Amber to make sure we're clear that this is to the governor and the legislature, and finally this correction that we have on the bottom of page 1. Regarding developing recommendations for an integrated behavioral health system. Would you please raise your hand if you can use your electronic hand here. Raise your electronic hand if you affirm this charter. Thank you. Okay. Great. This is our guiding document moving forward. I will finalize this and send you the final version, and we'll also post it to the website. And with that, let's check our time here. Okay, so we're not too far behind schedule. Thank you, everyone. We're going to take a 10-minute break. So I have 10:27 right now. If everyone could be back at the computer. Committee members with your cameras on at 10:37, we'll get started with our presentation on the Vibrant grant outcomes. So I'll see you back here at 10:37. Committee members with your cameras on. Thanks so much. See you in a few minutes. All right, welcome back, folks. Thank you, everyone, for coming back right on the minute. We're going to move into our presentation about the history and context of the crisis response system in Washington, and then the outcomes from the vibrant work. And we're going to start with Representative Orwell. I'm going to ask, let me just check in before we do that. Liz, are you able to run the slideshow now, or do you need me to do it again?
I can do it. That's fine. And also there's a question in the chat from Bipasha about the raising the hand. So can you please remind her how to do that? And
yes, and Bipasha and I actually emailed about that, or chatted about that. So I think
perfect.
We're good. But just a reminder for all of our CRIS committee members, Zoom likes to move around the controls every once in a while, just to keep us on our toes. And so the raise your hand function is you click the reactions button. Oh, thank you, Liz, you're on it. You click the reactions button at the bottom of your screen. So she's going to advance to that one. Oh, that's for the public. If you could go to the previous slide, it's on the previous slide.
I didn't intentionally do this. I was just pulling up where I took
okay.
off.
That's all right. I'll just say it verbally. We don't want to. So folks, at the bottom of your screen, you'll see your toolbar for Zoom. Far right, you should see a button that says reactions. And if you click on that, there'll be a little window that pulls up and it says raise your hand. But as I said, CRIS committee members, if you ever have something you want to say and you just can't find that button, please do send me a chat or wave your hands, and one way or another, we will call on you. So we're going to turn it over to Representative Orwell now to offer some brief context on how we got to this place. And then we're going to turn it over to Michelle Roberts with Department of Health to walk us through the Vibrant Grants outcomes. So Representative Orwell.
Thank you, Jamie. Very proud to talk on this. House Bill 1477, I call it the Orwell-Dinkra bill. Senator Dinkra and I have partnered on many things, and she's an amazing leader, and I was very proud to team up with you on this bill. I think with the help of Jen Stuber, I've introduced, 10 bills on suicide prevention. I'm proud of all of them. This is the bill that's going to save so many lives. And really, legislation is very hard to pass. And it really was the voices of people with lived experience, like Laura, like Abraham, and so many people that made their voices heard that really allowed us to move forward on this legislation. And of course, will be critical in fixing the system, in providing services and within the system. Next slide. So I'm going to talk about three things. I'm going to talk a little bit about the current crisis system, the vision for 988, and then House Bill 1477. The backdrop of this slide, I think about the person in our community that has no knowledge of any system and has a family member in crisis, and how complex it must be to navigate. And I really think the work we're going to do is going to make the path much more simple and easy to use. Next slide. So this might date me, but I don't know how many of you remembered having this card on your refrigerator. Sometimes we think 911 has always existed, but it hasn't. It was created in the 60s. People said it was passed because of really tragic and horrible situations. Some people say it was civil unrest in Black communities. So it has a very unclear origin, and it's changed over time. So it's so important to recognize that these things are built. I think 10 years after Congress passed 911, 10 states had started to implement it. So it took many years to bring it on board. Next slide. But we know we've created these robust systems, right? If you have a fire, this rapid response, safety issues, medical. If you live in King County and you have cardiac arrest, you have the greatest chance of survival than anywhere in the country. These systems have been highly effective. Next slide. But we also know that 911 was not designed for people with behavioral health crisis. Our law enforcement has become the default responders because of an underfunded and kind of fragmented system. And we know 1 in 4 police shootings are actually involving someone experiencing a behavioral health crisis. As a social worker, I work with a lot of law enforcement on many issues, but they really do not see themselves as social workers, though they are part of our partnership around crisis. So these are the things we need to think about when we design a system. If you see the pictures of the phones, the one on the far left was my phone when I was a Western liaison. It weighed about 5 pounds, and I probably got a lot of radiation. And you see the new iPhones, right? You know, technology evolves and systems evolve too with our help. Next slide. And of course, the 988 is a national number. It will start in July of 2022. Many cell phones, they say 95%, actually, if you hit the 988, it will connect you to the suicide prevention lifelines. I do want to point out that all of our bill, and I'm going to thank Representative Lauren Davis, really says behavioral health. If you look at other states, they say mental health crisis and suicide hotline, but we really have recognized for many years in the state for the integration of behavioral health, and we're not done, but we recognize the need to integrate those things. Next slide. I want to acknowledge just, it took an incredible amount of work at the national level to pass 988. I can't imagine a more important time for us to be doing this work. Again, you know, people are talking about mental health. They're under enormous stress. I think about our youth all the time who have been so hard hit by the pandemic. And so I would just want to recognize the leaders at the national level. This idea and this legislation actually came from our neighbors in Utah, and want to recognize them. And the national level, and the next couple of slides are from Crisis Now, really have provided kind of the overall vision that I'm going to talk about, and provided a lot of technical assistance to our state that really allowed us to move forward and do work this last session. Next slide. You know, there's really the 3 components that have a strong focus really in our redesign. First is the call centers and how we expand and the work they do. The second really is that mobile rapid response. And the third is really crisis stabilization and what that looks like. Again, who responds and how responds is really how we create a more trauma-informed and supportive system. You know, I think of the crisis stabilization and people spending hours in emergency rooms, again, is an example of how our crisis system may actually cause trauma versus providing support. So again, wherever you call in the state, we want you to get the help you need and deserve. Next slide. So Crisis Call Hub, and this is kind of like air traffic control is supposed to be care traffic control, right? Where when airplanes are in the sky, they follow them, they support them from the beginning of takeoff till they land. And we want someone in crisis to get that support from the time they call and reach out to the time they really connect to the services they need to really be in the community and be supportive. A lot of these states like Georgia and Arizona are a little bit ahead of the curve. They've had more centralized call lines that are really tied to GPS mobile teams where they can rapidly send mobile crisis teams in different parts of the state. The other key component that's really being looked at is follow-up care. Again, calling and checking on people after they've made contact with the Crisis Call Hub. Next slide. The mobile crisis teams. Again, this is being designed as a clinical response. Peers need to be in every part of our system, from the call center to the teams, using technology to really, at this point, it's really locating the team members and seeing how they can rapidly respond. Again, you know, when Georgia and Arizona, they find about 10% need crisis outreach of the calls that come in. But for those percentage, we really have to have a rapid response if people are going to call 988 instead of 911. And that's probably like a 15-minute window. So really, it is enhancing our system, our current crisis system, to be able to do that. Next slide. And I like this slide. We want to create places where we would all be comfortable, that would be calming and supportive, and just feel part of the community for people. And there is this certified 24-hour crisis centers that are in many states. We don't have them here. And so we have an opportunity to also bring in some best practice resources that are funded by Medicaid and federal dollars as we redesign our system. And again, it's going to take time to get a lot of these resources up and running. We might have to, really have capital budget requests. And so we're looking at 2 or 3 years out, but these are kind of the vision of what we can create in our state. Next slide. So part of this slide is and it's kind of the left side is taken from Crisis Now. And it's very tiny print, and I apologize. You can see a little 1 in the corner of the gray box. The Crisis Now, we were the first state that they presented on for 988 bills. I'm very proud of that. So this is kind of the slide they used. So I think there were 4 states that were able to pass 988 with the fee intact. And then there was another handful that got something to acknowledge 988. So we're really ahead of the curve, and I'm really proud of that. We have a lot of work to do. But the purpose of this bill is to begin that process. The other thing is it started at the fee, and the fee starts this month. So look at your phone bills this month. There should be an additional 24 cents, which is dedicated to 988. This is the same funding source that they use for 911. It starts at 24 cents and then eventually will go up to 40 cents. And again, I think it brings in about, I think it was about 50, I can't read my own slide, but I think it's like 54 million a year. So it's a significant amount of money. We're using some of the initial increase to support our call centers, which I'll talk about next. I'm very proud, and I want to recognize Vicki Lowe and Department of Health and Healthcare Authority. We have the first 988 tribal line, which is going to be incredible, which would be answered by tribal behavioral health specialists. We're also really using this CRIS committee and all kind of voices and feedback to begin extensive planning. So we're getting our call centers up and running, but we also really need to say, what does the current landscape look like? And what does it look in different parts of the state? And how do we build on that? And how do we partner? One of the things I'm really proud that's unique to our bill is next day appointments. And not only on the Medicaid side, and I know King County has some of these, but we want to see the Medicaid throughout the state, but also with the private insurance plans. We know people wait weeks to get in appointments, yet most of the antidepressants are actually prescribed by private providers, family practice mostly. And so we need all partners at the table. I want to recognize OIC. They're really working with us. And I think that's a really exciting part of our bill. And again, we did a little bit of investment in our crisis teams, but really the next 2 phases will be investing in crisis response and in crisis stabilization. Next slide. So we have 3 amazing call centers, and they're on the line today. We've been out visiting them, and they just are so dedicated and doing great work. And so we know a lot of them will be using the new resources to double their staffing. They already do suicide screening and triage. We're adding the follow-up component. The other thing that's really important is not only to be able to call, but write text and chat. And we know that's especially important for youth. And so really adding that capability, making sure that they have the partners with the crisis teams in the community so that they can have people who can respond to people in crisis. And again, I've talked about next day appointments. I might have Senator Dingras say a little bit after I'm done about the bed openings, but that's really important, how it connects to the system and really having warm handoffs. We know there's an incredible amount of work to happen between 988, 911, EMS, law enforcement. How are we all going to partner to really make this system a success? And it's a complex discussion in our state right now, and a lot of us are working on how we clarify that role between law enforcement and mental health professionals, and that will be part of the work we're all doing as well. Next slide. So again, a lot of the planning you're going to do that we really need is really, what does our crisis response look like? What does the crisis stabilization look like? What kind of training is needed? How do we really enhance our teams in all parts of the state, including the rural, which is where actually the highest rate of suicide in our state is? How do we do it in a way that's inclusive? You know, I'm so excited. I think we can create something that's culturally sensitive. I do want to say I'm sorry we didn't have the ASL interpreter today. We will in future meetings, but we need every voice at the table helping to plan this system. Next slide. And again, I'm really excited about the structure we have. I'm really excited that we're going to have a committee with people with lived experience, because I think that is the key of creating a system and staffing a system that will be successful. And of course, it'll report back to the legislature. So I just think we have this once in a lifetime opportunity to rethink our system and to create it in a way that, again, is trauma informed, caring, supportive, and it's going to save lives. I want to again thank Senator Dingra, and I just want to say, Senator, would you like to make any comments on this?
You know, I'll just add very quickly. This is really an opportunity for us to do a lot of work that people have been asking for a very long time. A lot of ideas that people have wanted execution on that the state simply hasn't. Now's our opportunity to do so. So I'm very excited about the technology component, because I think this is also a place where we can store the Mental Health Advance Directive that we know can really amplify an individual's voice and their desire, but we haven't had a place to put this. So making sure that that's there so people can really make sure they're centering the voice and the needs and the requests of the individual seeking help. Making sure there's a centralized system for us to keep less restrictive orders, assisted outpatient treatment orders, things like that, that can really make sure we're providing holistic support and services. So again, super excited about this.
Thank you. And all your work, of course, is going to come back to the legislature, and look forward to teaming up with Senator Dingra and all of my colleagues. I want to do a shout out to Representative Dent and Senator Warnick, who have been great partners on this. And thank you, Representative Dent. I know you're going to be leading up the efforts on the agriculture side. Would you like to share anything?
Well, thank you, Representative Orwell. I appreciate that, and I appreciate this opportunity to be engaged in the agricultural sector, because you know, it's as we all know, it's the highest rate of suicide the agriculture sector is in the nation, and I would think that it's well overdue to take a hard look at how we can make some changes and engage our agriculture communities in this effort. So I do thank you for the opportunity and all your support for what I've been trying to do. So
it's great work, and I'm so glad we're teaming up. Senator Warnick, would you like to make any comments?
Sure. Can you hear me okay?
Yes.
Because I have been on the call the entire time, but I was joined by phone. So finally got my computer to work, and I will second the comments made by Representative Dent. We both live in an agricultural rural area with connection problems sometimes, but we see the effects of mental illness and suicide on our ag producers and their children. And that's what I am most interested in, is those young folks that see the struggles that their farming families are going through. So very interested in being part of this discussion. Thank you.
Thank you. And I'm so honored to work with such a great team, and thank you all for what you're doing.
I just want to jump in. This is Jamie again. I just want to jump in. I've gotten a couple of questions about whether these slides will be available on the website after the meeting. And yes, we will post these slides, all the slides that were used today, to the website after the meeting. So you can look there for the slides. Michelle Roberts is now going to present on the outcomes of the Vibrant Grant. And Michelle, we're getting a little close on time. I don't want to rush you, but I also want to make sure we leave time for our committee members to have their interactive discussion and, of course, public comment. So as you're going through, if there's an opportunity to sort of focus on the work in particular, that's the outcomes that are particularly associated with this CRIS committee, that would be, to the extent that you can do that, that would be wonderful. Michelle?
Great. Well, good morning again, everybody. Again, I'm honored to be here both professionally and personally as we embark on this really critical work. So Washington has participated, and I think somebody's pulling my slides up, right? sure. Yeah, there we go. Washington has participated in Vibrat's 988 planning grant along with 48 other states. This process has really set a foundation for the work we have here at the Department of Health, and really a foundation for this work with 1477 and the CRIS committee. So I'm going to highlight some of those accomplishments and happy to continue to provide more information as things unfold. I do need to acknowledge I'm presenting this work today on behalf of the DOH team who has led this work. Especially want to acknowledge our suicide prevention supervisor, Lizzie Caden, along with all of our partner state agencies, suicide prevention call centers, and many community partners. So as far as an overview of the 988 planning grant that has started in February of this year, it was funded by Vibrant. So sometimes you hear it called the Vibrant Grant, Vibrant Emotional Health, who is the national administrator of the National Suicide Prevention Lifelines. These private funds were made available specifically to help states prepare for the 988 number. The grant focused on developing clear roadmaps and planning for long-term improvement of in-state answer rates for 988 calls with a goal of 90% or higher. We're in the process of wrapping up the final grant deliverables, which are a landscape analysis and the Washington State 988 implementation plan. I'm going to share some of the key findings. So next slide. So a quick overview of the Washington State National Suicide Prevention Lifeline member call centers. We have 3 call centers in the state. You need to be certified by Vibrant to be a call center, and there's criteria and a process for that. So the 3 call centers are Crisis Connections for King County, Volunteers of America of Western Washington, which covers 38 of the counties, and it's the core chat and text center, and Frontier Behavioral Health, which is onboarding right now and covering 6 counties in the greater Spokane region. Washington State must ensure 24/7 coverage to the National Suicide Prevention Lifeline and call centers, and that includes calls, chat, and text, with no geographic region of the state without primary coverage. And we are proud that we're one of 5 states at the moment who has a member center that offers text and chat. Next slide. One of the things we really must work on is decide how to actualize a better strategy to fund our call centers. Currently, the member call centers operate at a $3 per call rate, and the estimated funding need for sufficient coverage and support is actually $67 per call. The system has obviously been severely underfunded, and this part of the conversation could be a much longer conversation. So I know we'll get into this over time in our CRIS work. Next slide. To address these concerns, as well as ensure that the member call centers can maintain target in-state answer rates, which, as I mentioned, is a rate of 90%. The 988 state planning grant team is working with current and 5-year projected forecasts to identify cost per call predictions and develop a 3-year plan to expand and sustain capacity. The landscape analysis gave us a better understanding of the operational realities and the key performance indicators faced by the member centers, and helped identify key planning considerations to ensure the call centers can meet Lifeline standards, the minimum requirements, and the performance metrics. For call centers, a big part of this is ensuring capacity can scale at the same rate of call volume that we expect with 988 implementation. The cost estimate that I shared on the previous slide will be a key for ensuring this needed capacity can be realized. Next slide. I briefly want to touch on our current activities that help to translate the planning efforts into our shared work here with the CRIS committee. We are very grateful for our partners in this work, Healthcare Authority, University of Washington, and the call centers, as well as the individuals who participated in our state planning coalition. Listed here in the slide is a summary overview of the coalition participants, but the group was very diverse, and we're grateful that people brought a wide variety of perspectives and knowledge to the coalition. One of the key messages that we've heard from the coalition over the past 6 months or so is how important it is to ensure individuals with lived experience are a part of the CRIS committee structure. We have really appreciated the feedback and are so glad we're able to implement it within the CRIS subcommittee structure, focused specifically on lived experience and the intentionality that we have done as we're setting up this work. We are also pleased that the transitioning members of the coalition, the Vibrant Grant Coalition, to serve on the CRIS committee and subcommittees or attend the forums and public meetings. So many of them are here with us today, and we've either as a CRIS member or joining as a member of public. And we just really want to make sure their work is transitioning into the CRIS work. Last slide, I've got one more slide. So key next steps also include ensuring that the member centers have a system in place to maintain local resource and referral listings and ensure there are culturally relevant support services for individuals across the state. The list here reflects the requirements from the 988 planning grant, but we've also been able to expand the requirements to reflect comprehensive care to more equitably include a wide range of behavioral health care needs and align with the requirements in 1477. So there you go, Jamie. Hopefully I made it through, and I'm happy, I'm sure, along with Representative Orwell, to answer any questions if we have time.
Michelle, you are a rock star. You got through a lot of content in a very short amount of time. Thank you for that. Folks, do you have any clarifying questions regarding either Representative Orwell's presentation or Michelle's presentation that we can answer now? Liz, maybe you could stop this screen share if you don't mind, and that way I can see everyone. Great. Okay, and just a reminder to our members of the public, I really appreciate your participation today. We are taking questions just from CRIS committee members right now, but if you have questions that you would like to have answered, please do send them. I'll post that email in the chat again. Please do send them to the email address at HCA, and we will work to answer them and maybe even create an FAQ document to help respond to things. Okay, I see Dylan.
Yes, I saw that the resource list was going to be updated annually. At what time of the year will that be updated? Is this going to be January 1st? Because I'm thinking that as a children, youth, and families provider, a lot of the update is really helpful for me, like in the summer, so I know like what's going to be available for during the school year.
That is a great question. I don't know if we've determined that yet, exactly the time, and I think that's something we really would like input on to the best time of the year and if annually is the right pace. So. And Lizzie is on. Lizzie from the Department of Health, is there anything you want to add?
And Michelle, thanks. You know, I would say that annually would probably be the minimum standard that we would expect. Right now, we've been doing it in the summer as we issue new contracts with our centers. But one good thing we do have coming on are our 988 staff, and somebody will actually be able to coordinate and collaborate with our centers and our partners on an ongoing basis. So my hope in the future would be that we would be able to formally issue an update at least quarterly, but we're gonna have to work to get there once we get our staff caught up to speed.
Thanks, Lizzie. And again, Lizzie is one of the key staff from the department.
Michael, I see your hand. Michael, sorry, Michael Redding, and then Michael Robertson. Michael Redding.
Thank you so much. Thank you, Michelle, for the information that you shared. One thing I want to observe is just noting from an ASO point of view, the great work that our crisis centers already do. And I noticed that you noted a 90% goal target of an answer rate. As an ASO by the Healthcare Authority, we're held to 95% answer rate. And our crisis clinic, Crisis Connections, has actually been very successful at meeting that measure for the past, at least for the past year. So I guess as we proceed forward from an ASO point of view, drawing on the good work that we're already doing.
Thank you. I appreciate you sharing that success, and I couldn't agree more that it's going to be really important to collaborate and learn from each other.
Thanks, Michael. And then Michael Robertson.
Curious question, the list of resources. As we know, the support system that is aside from clinical when it comes to peer support and peer-driven services, the age range. We know that the high suicide rate of adolescents and they are at risk and being pinpointed here. Where is that post-call support as it begins to fall in line on that first graph that we saw in the first slideshow? After the warm line response, when do juveniles and are they going to be part of this model of response? And how do we go about addressing that response for those adolescents that are at risk?
Can I jump in on that? That is an excellent question. I know it's something we were very concerned about when we did the bill. We're trying to add obviously people that work with youth and children as part of this planning team. We also need the voices of youth as we design this system of what's going to work. The bill had talked about specialized crisis teams that would specialize in children and youth. But I think, Michael, you're just really helping us realize and focus that so much of the planning needs to be how do we fully support youth and children, and it needs to look different than it looks now. And I think there was some recognition with the chat line and then the texting, but I'm hoping this group comes back with really strong recommendations for next session of how we do a better job on that. Thank you.
Kelsey, do you want to add anything to that? I know this is your particular area of expertise.
I did have something typed in the chat that I hadn't hit send on yet. So Michael, I totally agree with you. And I want to appreciate the fact that you brought that up. I mean, kids and youth need different services than adults do. And one of the things I didn't see on that list of resources yet was parenting supports for kids and youth experiencing crisis, because youth need those services and so do their parents and family members and caregivers, and the familial support in any structure that looks like for them wrapping around them. And so I would love to see some sort of parent, family, caregiver support added to that, as well as services and resources specifically for youth and young children.
Thanks, Michael and Kashi and Representative Orwell. Any other? Oh, Jen.
I just wanted to take a moment to also recognize our ED providers who, you know, in that slide, Representative Orwell, that you showed with the 911 and the fire department. And so there's a very large number of people either who are identifying with suicidal thoughts and attempts showing up in emergency departments, or who are found, you know, to be suicidal because they go there for some other reason. And I think one of the things that I've learned is that this summer, in talking to ED providers all across the state, is that we also need to be supporting them in this 90-day transition, because even though a big goal, I think, as an outcome of this would be to divert from obviously use of EDs and 911, at the same time, we have to recognize that this is always going to be a really important landing zone for people, you know, as we go through this. And I got the sense in talking to these providers that I think they almost feel, you know, kind of like our COVID healthcare providers in terms of dealing with this issue. Like, they are completely overwhelmed and burned out. And I think they definitely need support.
Thank you, Jen. I just actually, we're going to move into breakouts in just a moment. I just got a suggestion from one of our members that I think is a great idea, and I'm going to put it out there and see if our team can make it work. The suggestion was to have the 4 members with lived experience go into a room together just to discuss briefly the 4th co-chair opportunity and talk about what they think might be the best approach for one of them serving in that role. So Liz, I'm putting that out there because I know that we're struggling a little bit with our breakout tech. Would that be possible today?
I'll just create another room, and then those folks will have to select themselves into that room. So I'll put a note in when I explain what we're doing.
All right, thank you for that suggestion from our committee member. Before we do that, I want to check and see if there are any other clarifying questions or comments on the presentation materials. And just a note, we're saving the chats. There's also been some comments in the chats. We're saving that as well, flagging ideas for discussion in the future, as well as the comments that were raised in this conversation. All right. Well, thank you so much, Representative Orwell and Michelle, for your presentations, everyone for your comments and feedback. Much appreciated. We are going to move into breakout rooms. Liz, do you want to explain how the breakout rooms are going to work?
I'm muted, just a second. Okay, so what we're gonna do is you guys are gonna self-select, members are gonna self-select into the rooms that you see on the screen. So when I create the breakout rooms, there'll be 6 of, I'm actually gonna make 7 of them. So the members with lived experiences, please go to room 7. Everyone else, please go to the room that you see yourself assigned to on the screen here. I'm also gonna put these in the chat real quickly so that people can see that when they go and the facilitators can know everybody's in the correct room. Members of the public, you're gonna stay right where you are. So just give me 1 second and I'll start doing this.
Okay, and before everyone goes to breakouts, I just want to remind you of your questions. You're going to have a facilitator in your room is going to help you answer those. Your first question is, imagine it is 2024 and we have gone through this whole process. What would make you look back and say that was worth the time we spent? What, in other words, what does success look like? And then follow up is, what are your hopes for this project and what are your fears? And I'm just going to do a quick time check here. It is 11:12. I think what we should do is meet until, I'm going to make an adjustment because we're running a little bit behind schedule here. Let's meet until 11:30 and then we'll all convene in the main room again. It'll limit the time we have to share out what we heard in our different rooms. But what I think we'll do is document what the different rooms said and share that out to all of you in a written form so that you can see what others had to say.
Just 1 second.
And I'm assuming that the lived experience folks, after we're done checking in briefly, will hop over to our initially assigned room.
If there's time to do that, I think, yeah.
Yes, and if you have any trouble with that, when you're in your room, just click on the help button and one of us will pop in and help you all with that. Thank you for that suggestion. Members of the public, stay in the main room. We're going to have the same conversation in here.
It's going. Okay, I'm adding a room. Okay, so again, please self-select into your assigned room and we'll see you in a bit. Folks able to do that? Great. Perfect. I see people going into their rooms. That's wonderful. So Jamie, how much time are we doing again? I'm sorry, I couldn't pay attention.
Let's have them spend 15 minutes in the room. If you could send them a notification at 5 minutes and then 1 minute, that would be great.
Okay, so I'll send notes at 11:25, 11:20.
And if any of our members are having any trouble getting there, just let us know, we can help you. And everybody, thanks for your patience with the tech today. All right, once our members are moving into their rooms, we'll have a conversation here. Jen.
Sorry, I don't see myself on the list, so I can't select.
Oh, Jen, I'm so sorry. We missed you here. If
Hang on.
you want to, why don't
have
you
the
go?
list? Sorry, Jamie.
No, not to worry. Why don't you go to room?
6. She's in room 6.
She's in room 6. Okay.
Jamie.
Oh, there you are. You're over here. Yep.
Jamie,
Betsy, are you having an issue?
I heard someone else's voice.
Jamie, it's Bipasha.
Oh, Bipasha, yes.
I think I should be in room 7 as for part of the lived experience part.
Yes.
So what do I do?
You go ahead.
So click on the breakout rooms button at the bottom of your screen and scroll down to room 7 and then click join.
I don't see anything.
Okay,
Sorry.
I can find you and put you in there. So you're supposed to be, okay, just a second.
All right, and then in the meantime, Catherine, you had your hand up. Or did Catherine figure it out? All right. And Liz, when you're done with that, you may need to check and move folks who are not on the committee back to the main room.
Okay, let me go through the list to make
I think I
sure.
see someone who's in the. Okay. All right.
Do you see any folks?
I just moved one person back from the.
Okay, looks like you can move them too. Perfect.
Yes. All right. And if you could stop the screen share so I can see our group here. We'll have a conversation here. Let's see. There was a question that just came in from the chat. Asking, first of all, are the breakout rooms going to be recorded and posted with the rest of the transcript? Yes. These breakouts are going to be recorded and they will be actually added to the meeting file and posted to the website. And then there was a question about why people with lived experience are not divided up against the divided up again amongst the rooms. Excuse me, forgive me, stumbling over the words. The people with lived experience are going to have a brief conversation about who of them might want to be nominated to be a fourth co-chair. That was actually a request from one of our members with lived experience. So they're going to have that conversation, and then if there's time left after they have that conversation, they're going to move into one of the discussion groups. And then finally, why are the rooms private? The rooms are, so I think the question is if I'm understanding the question correctly, it's why aren't members of the public invited to participate in those conversations? I don't have a great answer to that question, honestly. It was mostly to, since they haven't gotten to, actually I do have an answer for that question. They haven't really gotten to know each other yet. So this is an opportunity for them to talk to each other and see each other's faces on the screen. But we are recording these, so that's not going to be an untransparent conversation. Each of our facilitators are going to record those conversations and you can watch them later. That said, if you have feedback on how we're approaching this, we do want to continue to make improvements as we go along. So we can certainly talk about making adjustments for future meetings. So thanks for those questions. I am going to actually open up the group question, I'm going to open up this discussion with the same question that we're asking our CRIS committee members, which is, imagine it is January 2024. What would success look like to you? And if you'd like to answer that question in this group, please raise your hand and turn on your video, and I'd love to hear from you. Okay, I see Mary. Thank you, Mary, for being brave volunteer to go first.
I'm there. I was having trouble getting off mute. You know, we would certainly be much closer to zero suicide with youth, children and youth. I think that in 2024, I will be thrilled if we have a system that does not treat children as small adults. It's so different. And one suggestion that I had that I was going to send in is, I think we need a specific subgroup for children and youth. I think we need to be so careful that we are paying close attention to the different needs and the difference in working with a child's family. You know, there are just so many things working with the school. When you talked about, or someone talked about that wraparound sort of an approach, I think it's pretty critical that we are doing that with children and youth. So that's my thought. And I just am so excited about this process. I think you're doing a great job. It's a kind of like herding cats, trying to get everybody into breakout rooms and things, but I just so appreciate this. And I appreciate being able to attend.
Mary, thank you so much for your kind words and for your thoughts, particularly about children and youth, and your suggestion that there might be a subcommittee specifically devoted to the unique issues facing children and youth. I really appreciate that. I see Laura's hand up.
You. First of all, I agree. I really appreciate your facilitation skills. It's not easy, and I've never done it like this. So
I will tell you, Laura, it's job security for me. Nobody really wants to do this.
That's really amazing. In fact, I'm supposed to be in an all-day conference right now, but they're having huge technical problems and they shut it down, so I could
Oh,
be
no,
here.
I'm sorry to hear that.
No, it's good that I can be with Chris though too, but you know, my hope really is that we completely turn things around. And that, you know, the previous speaker mentioning a focus on children and youth, well, I can understand that. I almost think not at the same time that we don't necessarily do population-based foci or, you know, research and other things like that, because I think it pulls us back to where we've always been, which is separation of demographics and populations, recommendations, even laws that get passed. So I also really want to root for the whole issue of truly understanding and drilling down what creates crises so that we can actually change the system that, you know, for people where those sensitivities don't ignite crisis, there could be, I don't even know what they could be, but it could be just about anything that sets off a group of people and, you know, really creates havoc in our system even. So are there ways to kind of really identify what's in our society that creates these kinds of issues? I mean, medication actually is one of them. I take medication, but I also know that if I were to come off of medication, that could create a crisis. Or if I'm taking too much medication, that could create a crisis. So what are the, I'm sure there's some research terms for this, antecedents or something like that. Anyhow, those are my thoughts initially. And again, thank you for not excluding the public, actually, very much, and having us be engaged. Thank you,
Laura. Thank you for your kind words. And I appreciate your perspective, you shared perspective on maybe some of your perspective on taking a population focused approach. I appreciate you sharing that and your thoughts about what success would look like and a need for an overhaul. I saw another hand up, although it might have gone down there. Let's see, Elizabeth Gordon, and then Shannon, and then Val. Elizabeth.
Yeah, I think I'm really excited about the about this project and the hope for being able to create more I can't say that word today, destigmatization around a mental health crisis. And I would really hope that by that date, we are looking at a way to create a no wrong door approach also, so that if people are going in and they're connecting with a private provider, that there would also be tools for private providers to be able to deal effectively with people's mental health crises. So that would be another hope I would have.
And Elizabeth, your remarks echo a lot of what I've heard from your fellow CRIS committee members, both about private providers and particularly about destigmatizing mental health. So thank you for that. Shannon, and then Val, and we might be out of time after that. So folks, if you don't get a chance to share your vision for the future and what success looks like, please do put it in the chat and we'll make sure that we document that. Shannon?
Thank you. So I just wanted to say I'm glad to be here today. I represent the Washington Mental Health Counselor Association, and we're so excited to be a part of this process. But one of the things that we hope from our association is that when we get this system in place, it's really looking at taking care of our most vulnerable, that our most vulnerable population is having resources and being served. And then the other thing that always comes up is that we are hoping we get this in place, but we have enough bodies to do the work. There's a huge workforce shortage, and we really, really want to be a part of whatever happens to get more providers in our state. So that's where we're at.
Shannon, that workforce issue has come up again and again in our, and folks, just for context, one of the first things we did was held introductory meetings with each of our CRIS committee members. So we actually got to hear from them some of their answers to this question, and Shannon's point about workforce came up again and again. So we know that that's a serious concern for a lot of our members. Thank you, Shannon. Val.
Hi.
Hi, thank you very much. Just very quickly, I wanted to echo some of the earlier comments on looking at children and youth. And I would extend that to include youth up to the age of 25 or 26. So we're really looking at the specific needs of transitioning, which have unique needs within that population as well. And I'd also like to, in 2024, if I'm looking at this, I'd want to see that map really showing an integrated system overall. So we saw like a really good understanding of the spectrum of crisis services. What I'm not saying is that continuum of care into outpatient services that would allow for seamless exchanges and referrals to those necessary services from the crisis system. So I guess in a nutshell, not treating the crisis system as though it stands alone, but instead making sure it's integrated into the broader outpatient continuum of care.
Well, thank you for that, that your vision of success is an integrated system. I appreciate that. And I just want to share with everyone, I'm getting a number of great ideas in the chat too. I'm going to make sure that I save these.
And Jamie will be saving them as part of the transcript from the meeting too.
Yeah, no, these are the ones that are just directly to me. And so
okay. Oh, direct. Okay.
I will make sure that those are saved as well, so we can get those into the record. We've learned from Zoom, there's little quirks like the chats directly to you don't necessarily save in the meeting transcript. So other thoughts from folks, we've got 2 minutes left, so we can maybe take one or two more remarks either on what success looks like or any hopes or fears that anyone has. Does anyone have anything else they want to contribute? Let's see.
Hey, Melody, there's no hand to put up. It's
no.
where it's supposed to be at. You know, I just really love the idea of first of all, the follow-up after the phone call. I think that's extremely important. And I like putting the subs with the behavioral health and continue to be as one versus, because I can't tell you how many times when I've taken somebody to get ITA, they're like, oh, well, you know, they're drug induced at this point. So it's substance use and that, you know, that's not us, you know, but they're, you know, having hallucinations and all kind of stuff. So, and I realize that it's drug induced, but it would be really nice that it's not one or the other and that we're not like skipping hoops to get from one place to another and it's seamless when it comes to getting services. And that's what it looks like you guys are working on. And I think that's really important.
That's a great point again about the need for integration.
Mm-hmm.
Elizabeth, I think we have like 30 seconds. So if you can make a 30-second comment, sorry about having to cut you off there.
No, I can definitely make it 30 seconds. I think just from the DOH role and trying to support this work, Jamie, if it would be possible, just as much feedback as we can gather around anything around equity and inclusion, and everybody brings such a unique perspective into this work. And I know the CRIS committee is going to be working really hard, but everybody's experience with the system and reason for being here is different. And so I'm really curious just to learn from the public how we can better support it. And so if we can incorporate that.
Thank you. Thank you. Lizzie, right? You go by Lizzie, is that right?
Yeah.
Okay. Thank you for that comment. I appreciate it. And we'll make a note of that for sure, that's a priority for you. All right,
Everyone's
welcome
back,
back.
Jamie. About 20 seconds.
Okay, I think we're still bringing people back to the room. Welcome back, everyone. I wanted to just take 5 minutes to hear some highlights from some of the rooms. We're not actually going to have time to have each room share out the way we had hoped, but that's okay because I'm going to ask our facilitators to share with us the highlights from the room, and we'll make sure that shows up in the meeting summary, because what you think about success as well as your hopes and fears are very much an important outcome from this day together. So really quick, does anyone have something from their room that they want to share, either one of our facilitators or one of our room members?
Michelle, if you want to speak for us, I'm more than happy to let you say a couple of quick words.
Absolutely. I'm representing room 3. And so a couple things that we'd like to share is one is what would make this worth our time. And a couple comments from that were that the actual resources are in place, that we have the contact centers up and running, but we actually have the resources that are available. There's a capacity and accessible to everyone. And also that everyone meaning particularly populations and not leaving out youth, young adults, all the way through older adults and seniors. And essentially there's also no wrong door. And then briefly on hopes, everyone knows the 988 dial code and is using it. That we also are eliminating inequities by race and other factors. And also aspirationally reducing stigma and for people who have behavioral health challenges and who want to seek support. And then last, fears that there would be confusion or lack of interoperability between 911 and 988. And that we are spending a lot of time right now putting out fires in the current system, and that there isn't the capacity or energy to actually really put forth some of these really monumental and important changes. And last on fears, are we going to be able to build the system and adequately staff it? We're all experiencing major issues around staffing and pay issues. That's room 3.
Thank you, Michelle. And I will say we had a wonderful discussion in the main room, and many of the things that you just shared with us were also issues raised by our community members who have been participating today. Carrie.
Thank you. I actually was not, I was raising my hand to sort of say something just to contextualize and not necessarily speak on behalf of our whole room. But I just wanted to say, I know that we've talked about this, but did want to point out that the legislature in these past few biennia has appropriated a ton of money toward behavioral health. And our group really talked about the wanting to make sure not only that workforce, but that wanting to make sure that we were going to be able to fund this adequately. And I wanted to just say publicly how much appreciation there is and notice there is for the appropriations that the legislature has put in place, the work that was done around 1477, and the continued work that we're all going to do together. And to let folks know that workforce and how we're going to all resource this was something that we brought up as well. And I think our legislature shows that they have these tough conversations and that they figure out how they're going to help to fund things. And I just really wanted to say that because I wanted to make that clear.
Thank you, Carrie. I think we have time for one last report share out from a room. Do any of the rooms want to share highlights? Michael, thank you for stepping up.
Yeah, we just kind of introduced one another and kind of talked about the fourth co-chair. And didn't really get to what 2024, and I'm kind of in agreement. I'll just speak for myself that that ideally in 2024 that it is for many demographics that the response and crisis system is the hijacking is done. The hostage response hostage situation as far as resources and response is done with, and that the resources that go within the system are pre-framed, sort of like an envelope that they're automatically go to. It's as simple as a thumbnail on your phone, as far as when there's a response that, oh, we know that this is somebody suffering from schizophrenia. We know that this is going out. There's a clearinghouse for medication because we can't get a hold of. There's a clearinghouse for all the records, et cetera, et cetera. That is happening, and it's as easy as the push of a button. And those not invited to the party are not invited. Those that are willing to be the coalition of goodwill and response and support are more than welcome to be there. That's what it looks like to me in 2024.
Thank you, Michael, for sharing that feedback. I appreciate it. All right, I think we need to just do a quick wrap up here and talk about action items and next steps, and then we will move into our public comment. So everyone, thank you, first of all, so much today for your energy and engagement, not just today, but also in our introductory meetings with you. I came out of those introductory meetings feeling so inspired and excited to work with you over the next 2+ years. Thank you also for your patience with our technical difficulties. Really appreciate that as well. And the grace you've extended all of us as we navigate this first meeting. We'll continue to smooth this out as we go along. And I also want to say something that I've said to each of you in our introductory meetings, but want to repeat it again, which is if you have any feedback, we are in a continuous learning mentality. So we always want to hear it and always want to continuously improve as we work together. So please do share that after the meeting. You can email me, give me a call. Although I am taking a little vacation for the next few days, so we'll be gone next week, but we'll be back in the office on the 11th. In terms of action items and next steps, as I mentioned earlier, HCA will be posting the recordings from today's meeting. It's going to take a couple of days to render them and pull them all together. So in a few days, you should see those up on the website, as well as the meeting materials, the slide deck. The agenda is already up there, but the slide deck from today, as well as the final charter, will all be posted at that website. And I'm going to post that website again. I've posted it a few times in the chat, but just so that everybody has it, I will make sure it's at the top of your chat. So please always go there to refer to meeting schedules and any other information. And members of the public, thank you again for being here today. I'm sorry that we weren't able to take all of your questions and comments. If you have them, please use that email that I shared earlier, and that is also at the bottom of that webpage, and send it, and we will do our very best to respond, and perhaps even create an FAQ, ongoing FAQ living document that we can post to the website. So that's it for action items and next steps. Unless Betsy, did I miss anything you want to add?
Nope, Jamie, thank you for your thoroughness as always.
Okay, so Liz, you're very welcome. So Liz, if you could share the screen. So again, we have 28 people actually signed up to make public comment today. We are going to make each comment 90 seconds, and that is in an effort to take as many comments as possible today. If you do not get a chance to say everything you want to say in that time, I know 90 seconds is tight. If you do not get a chance to say everything you want to say in that time frame, please do use that email that I posted earlier and is at the bottom of that website to send your comment. We will make sure that the CRIS committee sees all of the written comments in addition to listening to your comments today. So please do not feel that you're not going to be heard if you don't get to say everything today or you don't get called on today. I'm going to get through as many folks as possible. We've had a couple people who've already said they're not able to comment today after all, or want to yield their time. So we might make it. And then if we get to the bottom, if there's anyone who hasn't been called, is not on this list, who would like to make a comment, you can raise your hand and I will take as many as we can up until noon. I want to tell you a little bit about how this is going to work. I'm going to call 3 names at a time. So the first person is going to be the one who's going to be up next, followed by the next 2. So you know when you're on deck. Liz is actually going to be looking in our participants list to confirm that those folks are with us. When your name is called to speak, please turn on your video camera and unmute your mic. There is going to be on the screen a timer that's going to help you keep time. I've turned off the really annoying buzz at the end of it because I don't want to buzz you too hard, but I am going to ask you to stick to that 90 seconds and be really mindful of your fellow community members who also want to have a comment today. If you go over the 90 seconds, please forgive me. I am going to interrupt you and ask you to wrap up. All right, so this is our list here. I'm gonna
and Jamie, Nicola has been looking through participants, and she says that the first person that is in the meeting that's on the list is Nancy.
Okay,
I believe so.
Great.
Start with Nancy.
Thank you. I'm going to bring the countdown. I'm just putting up the countdown timer here. Bear with me a second. All right, so that means we're going to start with Nancy Shaw. And again, also one more begging of your forgiveness. Please forgive me if I mispronounce your last name. I will do my best. So first is Nancy Shaw, followed by Lisa Stridinger, followed by Nikki Saunders. And I'm going to share the screen so we can see the timer while Nancy gets ready to speak.
I guess my only comment on what I witnessed today is that well, I guess for starters, the chat should be more public. There was no option to chat amongst everyone. You had to send direct messages. There was no, you couldn't change it to everyone. You could just change the different names. And I think that it'd be nice if there, how you can call 988 to get services for crisis. It'd be nice if there was a sub number for people that aren't quite in crisis, but do need support. Maybe something really tragic happened and they're kind of freaking out a little bit, but not crisis freaking out, an in-between number, a peer support number, I guess you could say. I guess that's really my only opinions. Because you already answered my other questions, which thank you for clarifying that. That was very nice of you.
Thank you, Nancy. I appreciate your comments. Next up, I'm going to call Lisa Stridinger, followed by Nikki Saunders, followed by Sharon McKellery. And if you could go ahead when you make your comment, just again, state your name, and then you can dive into your comment. So let's go with Lisa. Lisa, you ready to go?
Yes. Good morning. My name is Lisa Stridinger. I am a peer housing case manager at a mitigation site, and I'm also an outreach worker here in Lewis County, Washington. I just wanted to say that implementing the 988 is going to be greatly helpful. I'm having a lot of hard times getting crisis intervention with the new House bills and with the officers and certain people saying that they can't interact. So I'm really looking into the bills to try to bring these bills and the language to the police force and to the people I'm working with, my peers, to let them know that there are ways that we can engage with the people. There are ways we cannot leave people that are in crisis just out on the street because the bills aren't being understood. So just trying to educate our community and let them know the different bills, the different language inside the bills, and try to coordinate through our care resource coordinators are on the streets to make sure our people in crisis get the right care. And just, I wanted to thank every single one of you that is on here because, you know, our people out there really need the right help. So I'm just here really to make comment and say that we're having a hard time getting our crisis responders to get the correct care. So everything you're doing is so important. Thank you.
Thank you so much, Lisa. Next up, I have Nikki Saunders, Sharon McKellery, and Britta Johnson, but I hear from folks that Nikki and Sharon, we're not seeing them on there. So I'm going to call then Britta Johnson. Nikki or Sharon, if we missed you, please raise your hand and we'll come back to you. So we'll take Britta Johnson, followed by Shanna Swan, followed by Susan Lynn. And Britta, if you could turn on your camera and state your name and then go ahead and start your comment. Is Britta with us?
I'm looking. I didn't see her at the top.
I think Susan Lynn is our next member of the public who is on.
Okay, wonderful. So we'll take Susan Lynn, followed by Bo Shattuck, followed by Lisa Koski. And again, if we've missed your name, right now we've skipped over Nikki, Sharon, and Britta and Shannon. Please raise your hand and we'll come back to you. So Susan. Do we have Susan ready to go?
I see Susan. I've asked you to unmute, Susan. Are you there? Susan? Okay. Why don't we move on? And I see her in the list. If she comes back, then if you can raise your hand, Susan, if you want to offer comment.
Okay, so we're going to go with Bo Shattuck, followed by Lisa Koski, followed by Trinidad Medina. Bo, if you want to turn your camera and start speaking, I'll start the timer.
I think Trinidad is the next person on the participant list.
Thank you, Nicola. So Trinidad, you're up. If you could turn on your camera and start speaking, I'll start the timer.
All right, yes, thank you. Good morning. My name is Trinidad Medina, and I'm the Chief Executive Director with Great Rivers Behavioral Health Administrative Services Organization. Yes, that is a mouthful. We oversee the behavioral health crisis system in Lewis, Cowlitz, Wahkiakum, and Grace Harbor counties. And we appreciate the opportunity to listen into this meeting and provide comment. At this time, my comment is just to express gratitude. Thank you to all who have contributed to House Bill 1477 and all the representatives on this work group and the others working behind the scenes. It's a lot of work. There are changes that are needed in the system. Great Rivers recognizes there are areas the behavioral health crisis system can improve, and we acknowledge that this is going to be a challenging experience. We appreciate the committee's leadership and recommendations that leverage, improve, and enhance investments that have already been made to the crisis system. And as an ASO, we support our ASO partner committee representatives and look forward to a crisis system that continues to grow and support the community needs. Especially thrilled about the technology and look forward to the work that's going to be done. And that concludes my public comment. Thank you.
Trinidad, thank you for your remarks. What I'm going to do is I'm going to keep going through our list, and then if we have time at the end, I'll go back and check in with the folks we called earlier to see if they're here. So we have Deidre Pierre, followed by Brandy Chrisman, followed by Paul McQuilkin. So Deidre, if you are here, please turn on your camera and you may start speaking.
And I believe Paul McQuilkin is the next person on our participant list.
Oh, okay. So we don't have Deidre or Brandy?
Exactly.
Okay. So then Paul McQuilkin, followed by Drew McDaniel, followed by Jamie Curry. Paul, if you're ready to go, please turn on your camera and I'll start the timer.
Okay. Basically, I just stated how I felt that it would look in 2024, or whatever it was. Anyhow, I think what we do is we treat a lot of people for drug addiction and alcoholism, and those are just the symptoms of the actual problem. The actual problem is a mental health problem that is either an emotional or a mental hurt that they have trying to kill. That's it.
Thank you, Paul. Next up, we have Drew McDaniel, followed by Jamie Curry, followed by Shannon Thompson.
And I believe Shannon Thompson is the next person on our participant list.
So Shannon, when you're ready, you'll be followed by Denise Lowe, followed by Griselda Haragwai. Shannon, when you're ready, you can turn on your camera and I'll start the timer.
Thanks, Jamie. I had messaged you saying you could skip me.
Oh, I'm so sorry. You're absolutely right. I forgot. Then we will have Denise Lowe, followed by Griselda Haragwai. Excuse me, forgive me for not pronouncing that correctly, followed by Bethany Baker. So do we have Denise Lowe?
I do not see Denise on the participant list.
Okay, how about Griselda?
And neither Griselda is also not on the list.
Okay, so then next up we have Bethany Baker, followed by Elizabeth Myers, followed by Vanna Singh. So Bethany, if you're with us.
The next person I see is Laura Van Tosh.
Okay, we'll just keep moving through this list. We might have time to take some more folks then. Laura, when you're ready, please turn on your camera and I'll start the timer.
Okay, good afternoon. Can you hear me?
Yes.
Okay, great. Thank you very much. I also, like many of the other speakers, want to acknowledge to no end appreciation to Representative Tina Orwell and her colleagues, Senator Manka Dhingra, Representative Lauren Davis, and all of the other colleagues that supported this measure, HB 1477. And I'm just really, really interested in seeing how we can make use of the time that we have and the ingenuity that we have access to create a system that people actually want to use rather than run away from using. And I'm one of those people that literally ran away or tried to in the University of Washington emergency room, and got caught and ended up going through a crisis experience that I'll never forget. And I think in the future, we really have an opportunity to turn some of those things around. I also want to recognize Dr. Carrie Waterland and the staff at DOH and HCA. And good luck to you HMA people and all the other acronyms that exist. Have a good afternoon.
Thank you, Laura. Next up, we have Nicole Hardy, followed by Heather Hernandez, followed by Rena Cummings.
I can't start my video. This is Nicole Hardy. My video won't turn on, but I'm off mute. So can you hear me?
Yes, Nicole, we can. Thank you.
Okay, so Nicole Hardy, she, her pronouns. I'm a certified peer counselor, and with lived experience, I'm just really grateful that I got to join this today. I'm interested in learning more and seeing how this unfolds. I think that lived experience is the most important part of approaching crisis, especially for people that have been trauma informed and have the lived experience. There's no better way of showing somebody how to come out of SUD or mental illness. And for people like us that have been there and done that, it's a lot easier to lead the way for people that are trying to come out of the darkness. So I just wanted to thank you guys for this opportunity. And then as far as the children were concerned, I got a bright idea while we were listening about since the age is 13 for children to consent to their own mental health, I think that the line should be open for 13 and older. And then maybe we could implement something like KIC, Children in Crisis, for children that are under the age of 13. And that's all I have for you today. Thank you.
Thank you, Nicole. We have Heather Hernandez, followed by Rena Cummings, and then I'll check back to see if any of the other folks who signed up are available to make their comments. So Heather.
And I do not see Heather or Rena on the participants.
Okay, and I'm going to circle back and see. I'm going to name all the folks we have on our list who we did not hear from today, and give them one last chance. And then if we have time, I'll see if anyone else in the group wants to make a comment. So we have Leanne Fackler, Jim Bloss, Nikki Saunders. So raise your hand if you hear your name called and you still want to make a comment. Sharon McKellery, Britta Johnson, Shanna Swan, Susan Lynn, Bo Shattuck, Deidre Pierre, Brandy Christman, Drew McDaniel, Jamie Curry, Denise Lull, Griselda Haragwai, Bethany Baker, Elizabeth Myers, and Vanna Singh. Do we have anyone who wants to take this opportunity to make their comments? All right. Is there anyone in our participant or any of our public guests who did not comment today who would like an opportunity to make a comment? I'm looking at our time and we have probably time to take 2, possibly 3 comments. Raise your hand if you would like to make a comment. Okay, I am not seeing any hands up. I'll give it one more pause in case people are trying to find that button.
Hey, Jamie, once again, there's no hand for me to raise.
Okay, who's that speaking?
Melody Euchre.
Oh, Melody. Okay. Yes, Melody, if you would like to make a comment, I will start the timer.
Yeah, I was just wanting to add on to what Nicole was just saying. It's so difficult to find services for 12 and under. And with the possible new laws changing where 12-year-olds and under can't be arrested, and that's coming down the pipe in a couple of years, maybe a year. it would be nice that it was easier for those folks to be able to access mental health, because often these kids who are 9, 10, 11 years old are experiencing mental health crisis. But the mental health folks will say, we're not going to take them because, they need to be held accountable for their actions. And, the juvenile detention facility can keep that person safe, so they can go there. And of course, then the next day, the courts lets them out because they're 9, 10, 11 years, 12 years old, and really don't need to be in corrections, and you be at mental health. So if there was a way to be able to access services easier for that lower age group, would be really helpful. And that's all I have.
Thank you, Melody. I think we have time for one last comment if anyone else would like to raise their hand to make a comment. All right, I'm not seeing anything. So I know we're getting close to the top of the hour here. Betsy, would you like to say any closing remarks to our CRIS committee members?
Yeah, thanks, Jamie. I would like to say, just express gratitude for your participation today, for your genuine interest, your dedication to this work. Every single person that we've spoken to so far has just really, it's just been a really great process to be a part of. So from Health Management Associates, we thank you. We're looking forward to the work together. I'm just very excited to be a part of this and grateful to be working with you all. So thank you. And we will endeavor to put together a good process and always want your feedback. So we will be working hard behind the scenes to support this work.
And I echo what Betsy said. Thank you so much again, committee members, public guests, for your commitment to being here, for your great engagement. It was a delightful 3 hours. We look forward to seeing you in November and maybe even in between. And I wish you all good health, especially now, and good physical and mental health. Be well, and I look forward to working with you. And I hope you all have a great rest of your day.
Bye, everyone.
Bye, everyone.
I'm not sure who the host is now to end it.
Thank you, Jamie.
Thank you, Michael. Take care.
Yes, absolutely. Have a
See
great
you next
week.
time.
Jamie, I'm trying to figure out who's actually the host now.
Maybe if we all leave, it'll turn off.
Oh, it's Rachel. It's Rachel. I'll tell her to be able, she can close the meeting.
Okay. She'll probably be relieved to get her computer back.
No, she is. Okay.
All right. Take care, everyone. Good to
Bye.
see you. Oh, and if anyone, I haven't had a chance to go through all the chat questions. I have recorded them. So if I did not answer you directly, I will make sure to refer any questions you have to our staff. So forgive me if I didn't get a chance to answer your questions directly in the chat. Be well, everyone.